This is a special meeting of the Community Redevelopment Housing Commission. Today is January 7th, 2020. Can we have everyone please rise for the Pledge of Allegiance? Mr. Charter, can you lead us to the pledge?
Put your right hand over your heart.
Over your desk.
I was going to say, ready again. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Chardiff. Madam Recording Secretary, can you please take roll call?
Vice Chair Aguinaga.
Here.
Commissioner Calderon.
Here.
Commissioner Frazier.
Here.
Commissioner Garcia.
Present.
Commissioner Perez.
Present.
Chair Santana.
Present.
Commissioner Sanchez. Commissioner Tardif.
Present.
Commissioner Vasquez. Thank you. We have quorum.
Seeing this, there's a quorum. This means officially called to order. This is time for a commission to consider matters under the consent calendar. Item number 1. Do I have a motion to consider item number 1?
I'll second.
Second. All those in favor, please say aye.
Aye.
Those opposed, please say no. Motion is approved by 6-0. We're now moving on to business calendar. We'll now consider matters under the business calendar. The first item on the business calendar is item number 2, which is the public hearing for the Community Development Block Grant, also known as CDBG, for fiscal year 2020 through 2022. Ladies and gentlemen, this is the time and place for a public hearing of the Community Redevelopment and Housing Commission of the City of Santa Ana for the Community Development Block Grant CDBG program for fiscal year 2020-2022, strategic plan number 5 and 1. At this time, we'd like to hear from the organizations who have submitted an application for the Community Development Block Grant program funds for the fiscal year 2020 and 2022. Staff have prepared a schedule of speakers from each organization. Each speakers will have 5 minutes to present their proposal to the commission. Staff will indicate when the speaker has 2 minutes left and 1 minute to speak. Commissioners may then discuss the propose and ask questions of the applicant for up to 5 minutes before the next speaker is invited to present. If there is anyone else who would like to speak about the proposal, you will have to have the opportunity to let your other fellow commissioners speak throughout the presentation. I would like to first invite our first speaker to present. That is AIDS Services Foundation of Orange County.
Hello, thank you so much for having me. My name is Sandra Boodman. I'm the Senior Director of Programs for AIDS Services Foundation. We have submitted an application to CDBG of Santa Ana, and I'd like to explain a little bit about our agency to start with. We have been around since 1985. We have over 30 years of experience serving the HIV positive community. In 2017, we changed our name with a DBA to Radiant Health Centers. Our legal name remains AIDS Services Foundation, and we expanded to the LGBTQ community. Our focus initially was on individuals dying with dignity with HIV. With the enhancement of medication and research, we are now able to assist people through their entire life cycle, from birth to death. We serve everyone from pediatrics until they do not wish to receive services anymore. And we help people with a very comprehensive suite of services. Individuals are very rarely dying that we see now, but they have great socioeconomic and health needs outside of HIV. So to give you a little bit of information, we, in the last fiscal year, we served, to give you some data actually on HIV, there are 7,262 HIV positive people living in Orange County. Most people don't think of Orange County as being a hub of HIV. We average 5 to 6 new HIV infections every single week in Orange County. There's estimates that approximately 893 individuals are positive and they don't know their status, which is a very staggeringly high number. In 2018 alone, there were 280 new HIV diagnoses. And it's important to note that the city of Santa Ana has the highest rate of newly diagnosed HIV cases in the county. Additional statistics, 40% of individuals newly diagnosed are age 25 and under. So folks often think of this as based on gender or based on age. We see the entire gamut of age and gender, but the disease is getting younger. So the averages are anywhere from 1 in 4 to 1 in 5 individuals walking through our door will be under the age of 25. So that means a lifetime of needs and care from an HIV diagnosis, and almost always the individuals we serve are living well below the federal poverty level. We also know that about 16% of individuals in the state of California don't know their status. It's important that people know their status because then we can get them linked to our services. We can get them in care. We can get them what's called virally suppressed, which in effect means they cannot transmit HIV. So our medicine now is so advanced, and it's critically important that folks get into care and stay on care, because that is how we get to zero. You hear on the national level a lot about getting to zero. It's about reaching the populations that don't know their status, giving them resources and support, getting them on medications, and they can effectively no longer transmit the virus. We are applying to the City of Santa Ana goal number 5, community health, livability, engagement, and sustainability. We hope to partner with the City of Santa Ana to continue the services that we do, to continue to broaden the services, and to serve the community of Santa Ana. We collaborate with a large number of other entities in Orange County, including AIDS service organizations and other support organizations. We have 2 service locations in Santa Ana because that is really the heart of the HIV epidemic in Orange County and has been for many years. And we have had a service location in Santa Ana now for 5 years. We also, as Orange County, hold the 3rd highest number of individuals newly diagnosed with HIV. So we have a lot of statistics we are really high on and should not be excelling at. We offer through our case management program a very comprehensive suite of services, including but not limited to case management with nurses and social workers, food services, mental health services, transitional housing services, and transportation services. So we have extremely comprehensive services, and this year we began offering medical care. So individuals can now come to us for all of those social services and also receive medical care. And that is my time. I'm happy to answer any questions that you have.
Thank you for your presentation. I'm going to start on my left with Mr. Calderon.
Sure. What is the ratio for every case manager per client?
So it depends on the level of care that the individual needs. So an individual who we would deem high acuity and would be working with a nurse case manager, that ratio is about 15 to 20 clients per case manager. Somebody who is lower acuity, it does go higher, and that's based on a really comprehensive assessment that we do twice a year to make sure that that person is still at the right level of care.
Gotcha. Okay. Thank you.
Mm-hmm.
Mr. Tardif?
Do you provide services in the different languages?
Yes. About 70% of our staff are bilingual in Spanish, and then we have several other languages that staff speak. If there's a language that we don't speak on staff, we contract with a translation agency that does telephonic or in-person translation. Language has never been a barrier.
Thank you.
Mm-hmm.
Mr. Perez?
So I was reviewed your contract, and you also get funding through the Orange County Healthcare Agency to provide wraparound HIV services.
Yes.
what services would be different than supplanting what funding you've already received in regards to this RFP?
So it wouldn't be different. Our Orange County Healthcare Agency grant does not ever cover the full cost of delivering services. So it is our responsibility as a nonprofit to seek additional grants to cover the full cost of those services. So they fund us for X amount of units, and then we usually have a variance in the $400,000, $500,000 range for case management alone, and we seek additional grants to fill those gaps to make sure we can continue our services each year.
So in the proposal, you're looking at serving over 1,600 and about 300 here, specifically in Santa Ana. Where do you also provide additional services? What other cities are you guys contracted for?
The entire county. So our contract with the Orange County Healthcare Agency is countywide. We never turn anyone away. So we find a way. So as individuals come through our door, we find a way to give the services. And if they don't live in Orange County or they are homeless in Orange County, we can serve. If they don't live in this county, then we connect them to HIV providers in whatever county they're going to.
And demographically, what age do you, I mean, I know you focus on all ages, but just historically from, the work that you've been doing, what would you say is the age-specific population that significantly is higher percentage-wise?
So the HIV community is aging dramatically. So for the first time last year, we served a handful of individuals in their 80s. So when we saw individuals no longer living past, a year or two past their diagnosis, we see an aging community every single year. So in this last year, we entered into a contract with an aging services collaborative. So 45 to 65 is our largest age demographic, and that percentage goes up every single fiscal year.
Thank you. Appreciate it.
Mr. Frazier?
Yes, thank you for your presentation. I don't know if everybody up here knew as well. I sat as the chairman of the HIV Planning Council for Orange County up until October of this past year. And I've sat on it since 2015, so I'm very familiar with the statistics that you were going over, and that we share a lot of similarities with Anaheim in our respects to that. What I'm curious about is that you said that the amount of money that you're getting from the Ryan White funding that you receive from the Orange County Healthcare Association is never enough to cover the cost. As far as I knew, there were no wait lists for services to be rendered to individuals. What costs are you looking at that aren't being covered, that would need to be covered by this additional funding?
So it's the cost of case management. So it's true, we do not have a cap. I've been with the agency almost 6 years, and we've never implemented a wait list for any of our services. So there's a cost per each unit, and each grant covers X amount of units. And we, every fiscal year, surpass units for all grants that we are applying to.
And how many service units did you provide last year across the board?
That I would have to go back and reference in terms of the totality.
Okay.
I can tell you that last year, fiscal year, we served 1,600 HIV positive individuals, and then total as an agency, we served 5,700 individuals. So we do a lot around prevention as well.
Okay. Now, so you said prevention, and then there's the PrEP that is coming out. But I'm still looking at the counselors. You said 15 to 20 counselor or clients per counselor when you're dealing with a nursing level situation. The clients that you have that are dealing with case management at the level of getting in linkage to care, making sure that they're linking to doctors, that they're linking to their eligibility, that they're linking to all of the various entities. What does that number look like? What is that client to counsel ratio?
So for someone newly diagnosed, they will be on a caseload with one case manager of 20 to 25 clients.
Okay. And how much time does each client typically get with that case manager?
It's
per
very
month?
hard to say. It varies. It's really what the client wants and the client needs. And each tier and level of acuity has different requirements. So for example, somebody who is newly diagnosed, they're generally with that case manager for 6 months. That's an intensive case management program meant to really bolster support services after someone has found out their diagnosis. And they have to be done, there's an assessment done every quarter, roughly, and then they have to be met with or spoken to a minimum of monthly. But it depends on the client's needs. If a client says, I'd like to meet with you once a week, I'm really having a hard time, then we do it. So it's really meeting the individual where they're at, but at minimum, everyone has assessments every 6 months. Newly diagnosed are generally every 3 months.
Okay, so minimum you're looking at, say, let's say roughly about 2 hours over the course of the year of just bare minimum meetings, half an hour for your assessments and recertifications?
No, each assessment is about 3 to 4 hours.
3 to 4 hours.
And then there's follow-up assessments, and then there's evaluations throughout. It's really hard to give a number, but every touch point with a client is different, but just assessments alone are about 4 hours. And then we also, some clients want us to attend the doctor with them. So we go and attend the doctor and help with translation. We may spend 10 hours in 1 week with a newly diagnosed client who needs a lot of support. So it's overall a pretty intensive program and intensive services.
Sorry for the interruption, but we want to stay on top of time. What I can do is I can give you my 2 minutes, and then we can first go to Ms. Garcia, and then you can come back and ask her follow-up questions.
Yeah, I just have one last
Yeah,
question.
Ms.
so
Garcia,
Go ahead.
I do not have any questions. Just thank you for your presentation.
Thank you.
Ms. Aguinaldo.
I'm just curious about, I'm very acquainted with your program because in past times I went to the house where you run the program. Did you open any other facilities, or is there only one still?
So I think are you referring maybe to Mercy Housing in Anaheim?
No, the one here in Santa Ana.
Oh, okay. So we have 3 sites currently. Our main headquarters is in Irvine. We have a satellite location in Santa Ana that operates under a CDC contract, and then we have a second satellite location in Santa Ana that is a medical suite.
Okay, thank you.
Thank you, Ms. Aguinaldo. Back to you, Mr. Frazier.
The last question I have, and I really appreciate you bearing with me on this. I'm just curious, the amount of funding that you're asking for, what is the split that we would see of going to services versus going to administration?
So our administrative costs, we allocate 10%.
10%?
We go with the standard, and that's across the board. We do that for all grants.
Okay. Thank you very much.
Thank you for your time.
You're very welcome.
Next up, can we please have America on Track? Hi, welcome.
Thank you. Hi, good afternoon. My name is Claire Brayburn. I'm the Executive Director and co-founder of America on Track. We're a local nonprofit based here in Santa Ana, across the street, actually, so I walked over. Going to give you a little bit of just very brief overview of our organization as a whole, in case you're not familiar with us, and then give you details on the program that we're requesting funding for. So America on Track was founded in 1995 by myself and Terry Thompson, and our programs truly are about creating hope, opportunities, and life-transforming programs for the most vulnerable children in Orange County and in Santa Ana. We specialize in focusing on the hardest-to-reach vulnerable kids who really benefit from our programs. Terry and I started this company 25 years ago in April, and we are just as passionate today about serving these children and families as we were back in 1995 when we started, and in 1998 when we won an award for these programs from the President of the United States. Our mission as an organization is to build youth leaders, support families, and strengthen communities through our programs and through our partnerships with the residents we work with. And we're really proud to share that we currently serve over 44,000 unduplicated individuals every year across our 5 multifaceted programs, and we are still allocating 91 cents of every dollar directly to program services. So we try to be very efficient because we know there's always another child or another family out there that can benefit from our programs. And we have a number of programs, and I'm sharing that because this is one of the ways where we ensure that we meet our goals in terms of the CDBG program that we're requesting funding for. All of our different programs work with families in the Santa Ana community so we can do self-referral as well as referrals from out throughout the community. And I apologize, the formatting, I should have just sent a PDF, so the fonts are all crazy on the screen, but I think you get the idea. We have leadership development programs, mentoring programs, programs that focus on academic achievement, fitness and nutrition, and drug prevention programs. And everything we do is science-based evaluated from an external firm called the Center for Applied Research Solutions. We have an Emerging Leaders for Civic Engagement program here in Santa Ana, as well as in other communities where we work with high school students and 4th and 5th graders to train them to be civic leaders, get involved in their community, train them on public speaking, and drug use prevention and fitness. We also, for the last 12 years, have done a physical education program grant in Santa Ana as well as in other communities that's been highly successful. And you may be aware of our current nutrition education and obesity prevention program that's throughout the city of Santa Ana as well as in the city of Buena Park, and that's the goal of that is to make the healthy choice the easy choice for SNAP-Ed eligible families here in Santa Ana. And then we have tobacco prevention programs that include vaping to help reduce exposure to secondhand smoke and to help make sure that young people aren't getting their hands on tobacco products. The program we're asking for funding for our CDBG is our Brighter Futures for Children of Prisoners program. It's very unique. These kids suffer the consequence of something that their parent has done that's no fault of their own, and they also have a stigma of not being able to talk about that. So our program really provides them so many opportunities to be around other kids who also have that, and they're able to connect through that bond to know that, oh my gosh, I'm not the only kid in this situation, and to know that they can succeed and have a really bright future. So we provide them with a number of services through this program. We, of course, provide them with an adult mentor who's carefully trained and screened. We also have a college camp where they live in the dorms, have fun activities. We give them science, technology, engineering, and math workshops and outings. They got to tour the county building just across the street before it was finished, and that was super exciting. We do wraparound services for the families. We have free books. Every time they see us, they get to add a book or two to their collection to take home, and then fun special events at the Honda Center and other locations. The mentoring component, we provide training to adults from throughout Orange County who'd like to mentor a child of a prisoner. We do several background checks. We have the subsequent arrest background checks. So we make sure that they are going to be a positive role model and a good friend to these kids. And then they're required to meet with them for 2 hours a week for a minimum of a year. We have some who've been with us for 15 years and others who stay for just a year. And they do also fun activities together, and just also give the guardians a break, because the guardians who are left behind who are caring for their kids, oftentimes it's a grandmother or a foster parent or an aunt or an uncle who's raising several children, and oftentimes at an age where they thought they were done raising children. So it gives both the kids an opportunity and the guardians. And the jail problem is huge, $265 billion cost to our society. So we want to make sure these kids know that they don't have to follow in those same footsteps, that they can have a really successful life and achieve their dreams with hard work and a lot of love and support. And there's just beautiful pictures of our kids. But I'll stop talking, you can see the kids. Any questions for me?
We'll start with my left with Mr. Calderon.
If you could just go back to the
Yeah.
If you could just go back to the slide where the program of like what it entails. I think it's at like the mentors.
Yeah.
Like where the time cut off.
Yeah.
My question is, you mentioned that they are, mentors that are assigned to the kiddos. What are the qualifications of the mentors?
So, sorry, I'm trying to go, here we go. The qualifications, so we recruit people and they have to come in, they get screened by phone first. So the first qualification, they have to be over 18 years old, they have to be able to drive because they have to be able to transport the children, either pick them up from school or from home, depending on the day of the week and the time of the day that they're meeting with the child.
Got it.
Yep. And then, so those are just some of the basics, but then they get screened by phone first, they come in for an interview, learn more about the program, they're able to ask us questions, we're able to ask them questions, and then if they agree that yes, they'd like to move forward with the program, they have to go through two trainings with the president of our organization, who's the director of this program, and they're each 4-hour trainings at our offices. They have to provide us with 3 references who actually take our calls and give us a reference, so we do those reference checks. And then we also do the live scan screening for both California Department of Justice and the FBI. We have the subsequent arrest notification, and we also do the Megan's Log screening.
Okay.
So they have to pass all of those steps before we will give them the information on this child. So if they show up to the first training, they don't show up to the second, they're not in the program. I mean, they really have to stick with it. One of the other things that I didn't mention in the presentation is throughout the year, they also submit online mentor activity forms to let us know what they're doing with the children. So it's just a simple form. They fill it out once a month. We remind them, and it just tells us, how's the kid doing? And they're just kind of measuring the progress of the child on a number of items. And then they also let us know that on this day, I took the child out from this time to this time, and these are the activities we do. We went to the park, we went to a museum, we went to a movie, and just letting us know what they're doing so we can provide feedback. And then there's an area where they can say, these are issues of concern that I'd like addressed by American Track for my mentee, and Terry reviews those and responds, and then depending on what the need is, we get them some extra help. That's a lot of where that referral and wraparound services for the guardians comes in, is through those notes, because the mentors are going to the homes and providing feedback saying, wow, they need X, Y, Z.
Got it. All right. And then my next question is, how many new applicants are you getting like each year, or how does the cycle go for the kiddos?
So we recruit, so once they start with us, they're welcome to stay for as long as they want to be in the program. And that's really why we've developed a comprehensive program, because these kids benefit from having the support of an organization that's there to support them no matter what's going on in their lives. The mentors are one component, and mentors will come and go. So we want to make sure that these kids and these families understand that we're here to stay. So if a mentor, which is out of our control, if they, after 6 months they flake out, we do our best to screen them, but nobody's perfect, and that's just the way programs work like that, which is why we've built in all the other things. So the children are welcome to stay with us until past 18. We develop leadership opportunities for them as they get older in the program. So we have several who at our college camp come back as junior counselors. They start doing volunteer work with us in the community as they get older and get to know us and the things they'd like to do. So with that said, we maintain those children, but we're always recruiting anywhere from 75 to 125 new children every year.
Got it. Okay. And then what's the ratio for every mentor?
One-to-one relationship.
Okay. Cool. Thank you.
Sir?
Thank you for your presentation. Can you let us know what some of the free, fun, special events might be?
Absolutely. So one thing that we do every year is we have a phenomenal holiday party for the children, and we do that. We're across the street in the Civic Center Plaza Towers where the Dante's Coffee is. If you've ever been in that building, the downstairs lobby is quite large and nice, and our offices are in that building, and so they allow us to use the lobby every year on a Sunday. We shut it down, nobody else is there, and we have a huge holiday party where the kids get gifts and books and games, and we have a photo booth, and we have food. So that's a really fun activity, and that's an opportunity for us to interact with the mentors, with their mentees, during that fun day. We also, if you saw one year, Donnie Crivia is on our board, and a friend of his took a handful of the kids out for a boating outing. We have the STEM activities. We've gone to the Honda Center for champions on ice and gymnastics and basketball games and hockey games, so that's happening on a regular basis. We also have a relationship with the Chargers, so they go out for the Chargers, what's that? It's not Play 360, it's Champion 60 or something, I forgot the name of their event, where they go and do some football with them. So those are some of the different activities that we plan for
Very
the
good.
kids.
Thank you.
Thank you.
Ms. Claire, just if you can keep your response just to a shorter 2 minutes, just because we're running on
Okay.
a scheduled time. So
You can see I
next,
love it, so I want to tell you everything
Right.
because these kids are so fabulous.
Commissioner Perez.
Thank you. So I'm looking at your proposal, and you're talking about 75 additional students that you're providing, and then your numbers are 300 for 600 for the total of 2 years. I understand what those 75 students are receiving, but what are the other 225 unduplicated number? What are they getting?
So the guardians are receiving nutrition seminars, they're
But
receiving
they're the ones that are in prison, or the ones that are with them?
the ones that are with, so we're not able to connect, well, not easily, not able to connect with the ones who are in prison. So the guardians who are caring for the children come to our offices. We do, one of the other things we do is we do a basket brigade, so every Thanksgiving, we provide them with a Thanksgiving.
But as far as like educational,
Right, so during that time, they come in and we do a nutrition seminar with them. We do a fitness seminar of how to play with your kids more and kind of teaching. There's an active play movement going on in Orange County, so we work on that with the
and what is
parents.
different from the funds you receive for health and nutrition to that? Isn't that what you guys do with your health and nutrition funds?
The health and nutrition funds are specific to either a school or a location. So so we can't cross over, it's a great question, but the fitness program currently is in another city, so that one doesn't cross over at all, that funding. And the nutrition funding is for very specific things where it's a multi-session and we're over either at a school or at a senior center or at a partner agency. So
And what is that unit of service? Is it a 3-week, 4-week program? I mean,
we customize it for these families, so
Okay.
they're invited, but not all families are going to come to a multi-week series. So we customize it we invite them to our offices and we'll do one-on-one. We'll really dig a little deeper into some of the diseases and issues that they have, give them referrals out to like insurance resources. Sometimes they'll come to us before the back to school and they'll be needing support for back to school. So it's very customized what each family receives from us, but they all get that one-on-one kind of client intake and case management for the guardians. And then the siblings also get gifts during the
Okay.
party. They get the books, they get the outings. So we invite the siblings, even if
Perfect.
they don't have a mentor.
so the 10,000 for evaluation, what are you evaluating?
So we're evaluating if the children have made any progress. So we're looking at, are they doing better in school, which is not the first indicator that we're looking at in terms of academics, but certainly fewer suspensions, getting along better with peers, feeling more confident.
And the case manager is the one that gets that data?
Right, we have a number of ways that we're looking at, so we're collecting the data either during our camps, during our STEM workshops. At the end of the mentoring relationship, we'll do another survey and then give that over to our evaluator.
Okay, thank you.
Thank you. Mr. Frazier?
Thank you for your presentation.
Thank you.
I'm just curious, what is your retention rate for the number of mentees that then come back and become mentors?
So for this program, we've been doing it about 15 years, and I don't know the numbers for the numbers that have come back. They're a very transient population, so keeping them in the program consistently. I do have quite a few success stories of the mentees who've gone on to graduate high school and start college, and I don't know the exact numbers again as a percentage. I could give you all sorts of names and stories, but it's very difficult to stay in touch with these families because the phones are being turned off, they're moving, because they're like the poorest of the poor families that we work with. So it's really difficult to stay in touch with them, but I know a lot of them we get the stories because we're asked for support for going to college. And in terms of coming back as mentors, I do know that one of our young ladies just the other day, who's in our also in our Emerging Leaders program is like, I can't wait until I'm 18 so I can be a mentor. And she's been in our program for about 4 years, but I don't have an exact number for you.
And I just want to make sure that I understood this correct. You will serve an additional 75
Correct.
children through this?
Correct.
And currently, how many children do you serve through this program?
I just looked at I'm getting my second quarter report done, but my first quarter report, I think we were already at like
You were at 92.
92. Yeah, I was going to say I looked at the year before.
Yeah, and there'll be 125 this year.
Okay,
Yeah, so I'm at 92 of 125 this year.
Okay, and so when you add those 75 children, you'll also add 75 mentors as well?
Correct. I don't report the mentors on your form.
Okay.
I'm happy to if you'd like it, but I don't currently. It's been something we kind of gone back and forth on whether you want those numbers or not.
Thank you for your information.
Thank you.
Ms. Garcia?
Just to clarify, so you're going to serve an additional 75 children?
Correct.
I thought I heard you say earlier in the presentation that the funding will also help your STEM program and college experience summer camp. Is that correct?
Right, that's all part of this program.
It's all part of it.
So those 75 children, the ones who are over 11 years old, will be invited to come to the college camp. The younger ones can't handle the overnight experience. We keep trying, and they keep calling mom on the first night. So yes, they all get all of those services. It's not just the mentoring.
Got it. Thank you.
Commissioner Gonzalez?
We've been funding you since many, many years ago.
Yes.
So we go way back.
Yes.
Because I've been in this position on and off.
Yeah.
Do you still, so now you have, I know you for America on Track, right?
Right.
Claire, do you have any other ones? Because what I'm hearing is you're serving the brighter future for children of prisoners.
Correct.
But you do more than that, right?
Oh, yeah, we have a number of other programs. We have our Emerging Leaders for Civic Engagement, we have our tobacco use prevention, we have our nutrition, we have a lot of other programs that.
But the money that you're asking for is especially for this?
Exclusively for this.
Exclusively.
Yeah.
And do you asking money for the other ones too?
I did not this year.
So
Thought
that's
about
good
it.
to know. Thank
Yeah.
you, Claire.
Yeah.
And I know your background, and I know you're doing a great job.
Thank you.
Welcome back.
Thank you.
Thank you for talking about it. Mr. My question for you is very simple. What are you doing to educate the youth about tobacco? Can you just dive in a little bit more into that?
Yeah, absolutely. So we do presentations at the local elementary schools. We do presentations at our events. So like at the college camp, we do a presentation on, the biggest focus right now is vaping and the fact that it does have nicotine, it is dangerous, and it's not just some safe alternative. So we do presentations. We also get the young people involved in community affairs. We have a task force that the young people can get involved with, and they're actually very involved in that.
Your partnership with the California Tobacco Control Project,
Correct.
how do you guys work together so it's not, as far as education and outreach?
So through that funding, we have certain objectives that we have to accomplish, and part of that, we have a number of funding sources, so and we separate them in terms of what we're accomplishing, but we work with the young people to have a task force to ask them what they are concerned about, and when it comes to tobacco, how do they envision solving that problem. So at one school, they're going to their school and they're learning about it, and then they're trying to get their school administrators to do more about the problem when students are caught with vaping. Others are going out and doing community fairs with us. And
so is there a dedicated program specialist that focuses on tobacco, or?
in our organization, absolutely. It's totally separate from our Brighter Futures program, but I actually have two program coordinators because I have two separate. I have a county funding source and a state funding source, and so they are even separated out. So I have Alejandra Cook is my program coordinator for our state funded, which is more of a policy program. So we're working on voluntary and legislative policies. And then we also have the county program that is more of the youth engagement in terms of lowering youth access to tobacco.
Thank you for your presentation. Any further questions? Started? Nope.
I just had one I was going to give this, and whoever wants to hand this around, this is a testimonial from Angel, who's a resident here in Santa Ana. Have your tissue box ready when you read it.
Thank you so much.
Thank you.
Next up, can you please have the Boys and Girls of Santa Ana College Band? Ms. Claire, if she can hear me. Madam Secretary, are you validating our guest?
Yes.
Okay, thank you. Whenever you're ready.
Great. Good afternoon, Commissioners. Thank you for your time. My name is Crystal Duran, and I'm the Chief Operations Officer for Boys and Girls Clubs of Central Orange Coast. Our organization has served in Santa Ana for over 65 years, and we've been a proud partner of the city and the school district for a majority of that time. We work in the space of crime prevention, and we believe that in breaking the cycle of poverty through the power of education. As you know, I'm here today to talk about our proposal for CDBG funding for our college-bound program, which the city has generously supported and been a critical investor of for the last 3 out of 4 years. And our program essentially has 3 main objectives. The first is to ensure that all youth within our reach graduate from high school on time, that they graduate with a plan for their future, and that that plan is financially sustainable. Through one-on-one intervention, College Bound identifies risky behavior, and we offer counseling services, workshops, classes, and financial support to youth, guiding them to build a runway to propel them into their future beyond graduation. And that could either be a plan to go to a 4-year university, a 2-year institution, military school, or a trade school. It is tailored to whatever the desire is of that youth, and we guide them to achieve what it is that they are looking to accomplish after high school. Our program as a whole serves over 2,500 youth across Orange County. 1,800 of those will have been served in Santa Ana specifically this year. And we're on site at almost soon to be every public high school in Santa Ana through our partnership with the school district, as well as 2 charter high schools here in Santa Ana. We provide our College Bound program at no cost to our partners, and that is because we're able to secure funding by identifying opportunities like CDBG to support the work that we do. Last year, we served 1,600 teens in Santa Ana, and this year, again, we will be projecting to serve 1,800. We also distributed $50,000 in scholarships funded through the Boys and Girls Club, and we also helped secure over $2 million in financial aid for our graduating seniors just for their first year out of high school alone. I'm sure that you've all had help navigating your critical times to get you to where you are today, and that is essentially the work that we do. Our mission is to provide mentors and champions in life for those who need us, and that is essentially the essence of College Bound and why we've submitted our proposal today. I've submitted a handout for your distribution, and I'm happy to take any questions. And again, I'm so grateful to be here, and thank you for your consideration.
Thank you. I'm starting my right, Mr. Frazier.
I was just looking over your paper that you gave over here. Now, I'm curious, you went, for 2017 and 2018, you do a breakdown of who enrolled in 4-year institutions and community colleges. Do you have that information handy for the current?
You know, I apologize. I actually didn't break it out as specifically, but I'll get that to you within 24 hours.
I have nothing else. Thank you.
Ms. Garcia.
I don't have any questions, but thank you for this overview. It's very helpful.
Great.
Thank you.
Thank you.
Commissioner Aguinaga.
Thank you. I just had one question. The money that you saved to give a scholarship to the kids,
Yes.
or to whoever, do you follow up if that money is used for the college, or they can do whatever they want?
No, so those scholarships are secured through private funding. We then distribute those. The way that it works is they submit their, they activate it when they've enrolled in college and they've provided us proof of enrollment, and then we fund directly to that institution.
Okay, thank you.
Yes, you're welcome.
Thank you. Mr. Calderon.
The only question, great presentation. Thank you so much. I totally understand, the process of how it goes about. But my question is, out of all the high school students that actually graduate, what's the follow-up like with your program? Could you give us a little bit more information about that?
That's a really great question. So we've identified as an organization that there is quite a bit of risk for graduating seniors, that graduating them is no longer acceptable in and of itself. There is a great deal of risk making sure that those seniors then actually follow through on that plan. And so what we've done specifically this year, preliminarily last year, is we've launched, we've invested resources in our alumni strategy. We've also invested a lot more resources in programming throughout the summer after graduation to ensure that further engagement and to ensure that they reach that first class or touch point of whatever it is that they had planned to do. So we found that through statistics that if they show up for that first day of class at their college or institution, that their risk of dropping out dramatically decreases. And so we have made that a huge priority and have built it into our long-term plan to invest in alumni moving forward and tracking their progress.
Perfect. Okay, thank you.
You're welcome.
Commissioner Tardif.
Thank you for your presentation. I don't have any questions.
Great.
Commissioner Perez.
I don't have any questions. Thank you.
Thank you, Ms. Duran. Go ahead, Mr.
Yes.
Frazier.
I'm curious, so we've seen a trend with people entering into colleges where there's fewer and fewer men enrolling in colleges, and they're kind of exiting out of life, as it were. What does your program do to specifically address the drop in enrollment from males?
I'm sorry, from males from drop out in college or in high school?
Dropping out from going to college from high school.
From that transition period. We haven't tracked specifically the male demographic. I can certainly look at what our numbers are in terms of retention and seeing them follow through for their plan. I believe that our ratio of male and female is a little bit more skewed on the female side versus the male side, just in terms of who participates. But I can certainly look into.
And that's the question that I'm asking, is
Yeah.
to the degree that men are just not participating anymore.
Right.
And how are you mitigating that?
Sure. Well, our strategy has a two-prong approach. So we have our one-on-one case intervention, and then we also have our pipeline that we build. We've identified, not so much focusing on the male demographic, but that our biggest opportunity for engagement is in that freshman and sophomore year. And so what we've done is we've worked to build that pipeline by offering all of our other services outside of the one-on-one counseling for anyone to participate. So that could be male, that could be female, but we found that that is really what helps us build that pipeline moving forward, and our retention rate has strengthened because of our ability to offer kind of that two-prong approach. And we've been able to retain people who have come in with those more optional services and then committed to our one-on-one counseling services. Not sure exactly about the male ratio, though. I can certainly look into that.
Okay.
Thank you, Mr.
You're
Ram.
welcome.
I want to say I'm a product of the Boys and Girls Club. I really recommend all our commissioners to please take a tour of the teen center, teen space,
We would love
meet the
that.
kids. It's actually a fantastic facility, and I think you're doing a great job. Thank you so much.
Great, thank you.
Next, can you please have Community Action Partnership of Orange County? And just for those who are waiting in the lobby, we're also validating parking. If you have parked in our city lot, please come to the city clerk. She will give you a validation. And whenever you're ready. Whenever you're ready.
Oh, good afternoon.
Good afternoon.
Or evening. Thank you guys for having us. My name is LaShonda Mays. I'm here with my colleague Cecilia, and we're with Community Action Partnership of Orange County. Just some brief overview of who we are. Community Action Partnership of Orange County, our CAPOC for short, has been in the community for more than 50 years. Our main focus is how can we alleviate poverty in our communities. And we do that with a variety of programs, including our OC Food Bank, our utility assistance and weatherization programs, our family resource centers where we offer a multitude of services, specifically financial empowerment, which we'll get into later, as well as nutrition, health, and wellness programs. Recently, in the past year, we acquired the small nonprofit Southwest Community Center, located in Santa Ana. This community center has been around in the community of Santa Ana for more than 30 years, providing hot meals to those who are homeless or at risk of homelessness. As their executive director decided to retire this past year, we went through a process and acquired the nonprofit. With that, we were already collaborating with Southwest. We brought in some of our services, such as financial empowerment, where we've been doing the Santa Ana CDBG financial empowerment program so far. The CAPOC Economic Empowerment Program, Your Money, Your Goals, will provide low-income adults and youth in and around Santa Ana the necessary tools and resources to help individuals develop lifelong habits to increase financial well-being. Thanks to the City of Santa Ana, we've had this program for the past few months, and I'm going to turn around to my colleague, Cecilia, who will describe a little bit more about the program in detail and what we're requesting funding for.
Hello, good afternoon. My name is Cecilia Viveros, and I came on board to CAPOC in August when we acquired the Southwest Community Center in order to bring financial empowerment services to the residents of the city of Santa Ana. So primarily the difference between the financial literacy and financial empowerment is that where financial literacy is just based on sharing knowledge with the participants, we want to provide the residents with knowledge, tools, skills, and support in order for them to be able to better handle whatever financial goals they may have or financial barriers that they may come across in order for them to be more skilled to solve their own issues and concerns that they come across. Thank you. Additionally, we have three different services that we offer that I'm offering to the residents of Santa Ana, which the first would be Financial Empowerment Series, which is a collective of informative hand-on workshops where we cover a variety of financial literacy topics. And it is a series where we will discuss the information anywhere between 5 to 7 weeks, so they get the information on different topics different week. The other is the Financial Empowerment Workshops, where some agencies have just requested one particular workshop that we present to the community so that they then can reach out and receive one-on-one assistance when it comes to pulling their credit report, how to obtain it, how to be able to improve their credit score, working with clients to investigate possible identity theft with anything happening, whether it's them or their children, which I have come across, and additionally develop a customized plan of action based on their financial goals. Some of the topics that's covered through the series are the money conversations, emotions, values, and the culture surrounding it, setting goals and planning, saving for emergencies, paying bills, tracking and managing income, getting through the month, debt, credit, and additional financial services provided in the community. As of right now, our goals for the program is to provide 100 Santa Ana residents financial empowerment services, serve 15 individuals within the first quarter, increase sense of financial well-being in the households that we assist, in addition to set financial goals to develop strategies and achieve their goals. So far, I've been able to do series of workshops at the Southwest Community Center, at Godinez High School, at Madison Elementary, at Century High School, and I have 2 set workshops coming up at Jefferson Elementary and Taft Elementary. And then just to wrap up, so far I've been able to partner with the Santa Ana Unified School District and have outreach with the wellness centers at each of the schools. Also, I've been able to complete 3 different series of workshops, 3 individual workshops that I reach out at.
Thank you, Ceci.
You're welcome.
We're gonna move it forward. So we're gonna go with my left with Mr. Commissioner Calderon.
Can you go back to me? I'm just reviewing the PowerPoint right now, so.
Thank you.
Thank you.
To my right, Commissioner Frazier. Any question?
Over here, okay. Thank you for your presentation. I'm curious, have you done work with the Housing Plus program that the city offers as well, or have you had clients that have either come from that program or you've referred to that program as well?
No, I have not, but I would appreciate it if you can share that information with me.
They have a financial component to that program as well.
Wonderful.
And the other thing that I was wondering is the support and tools component. Where was that birthed from? Where did that come from? What did you use to design that?
So we actually are using the Your Money, Your Goals. So they are able, it's a free resource through the federal government that provides us with activities. Primarily the participants really like the handouts. They're like little workbooks that they give us. So we're able to do activities and apply realistic scenarios in order for them to grasp the concept. So the material is free, so we're able to use that to educate the residents.
Thank you.
Commissioner Garcia.
Just a quick question for you. So under the accomplishments for the 2019 program,
yes.
In terms of the Santa Ana residents that you serve, which were 75, and then of those 12 completed the 5-week series for your program, can you tell us if there's any follow-up with these individuals?
Yes.
And what do you track?
So currently what we're tracking is the number of participants per the requests of the grant. Additionally, we're also tracking their particular goals. So we want them to, one of the goals that we want is for everyone to at least have $500 saved, because $500 will cover the smallest or a good amount of emergencies. In this class, we discuss other amounts, but that is a basic that we want everyone to be able to attain. So currently the clients that I've seen so far, I do have follow-up appointments with them in about 2 months so that I can see what their progress is and how close they are to achieving their goals that they've set already.
And how long do you give them to achieve their goal? Like what is the...
It depends on the individual.
Okay.
And what their individual goals are. Yeah.
Thank you.
Of course, thank you.
Commissioner Aguilar.
I'm just curious, who's the president of this organization?
Gregory Scott.
And if this is the new house of the truck, excuse me, if this is a new house that was burned before, well, I'm confused about somebody else.
Yes.
It's the same one, right?
It's the same one. Yes, it was
And
born.
that was a woman that was.
Yes, Connie
For
Jones.
a long time, Connie
Yes,
Jones.
yes.
Connie.
Connie
I remember
retired.
Connie.
Yes.
Oh.
Yes, Connie is retired, I guess December officially, but she is still very much involved in the organization and still a dear friend to the community. So yes, we took over her legacy.
Oh
Yes.
my goodness. Well, yeah, I was there to just check out the program, but before the house got burned.
Yes.
Nice house.
Yes. Yes, they did a good job of building it up.
Thank you.
We don't encourage arson, but Commissioner Calderon.
I guess my question, is going to be, is there an anticipated date of like when you have these workshops planned? Because I'm seeing the location served. Like, what is that time frame going to look like for like going to those sites?
So the ones that are the 2 on the bottom, those are the 2 schools I'll be going to starting the 3rd week of January.
Okay.
So it's a 5-week series of workshops. So every week we cover a different topic, and then on the last class, like what we did before is I would come back on a separate day and we would pass out certificates to the participants that were able to complete the entire series of workshops. So that will be about 5 weeks. And then additionally, they have my information in every single PowerPoint so that I'm able to reach out to them as well. I have their contact information and they can reach out to me for an appointment. And I am there every other weekend. So I've had a good amount of success with participants coming in on Saturday or Sunday to come plan out their financial goals.
Cool. Thank you.
Thank you.
Commissioner Tardif.
Thank you both for your presentation. I don't have any questions.
Thank you. Commissioner Perez.
I don't have any questions. Thank you.
Great. My question goes to, I believe, Cecilia, since you're taking care of the outreach.
Yes.
Do you currently have an MOU with the school district? How are you getting yourself
Yes.
into the wellness centers?
Yes, that is correct. We do have MOUs with the Santa Ana School District. Additionally, I was able to participate at the beginning of the school year in an outreach fair where all of the
Great.
different centers came.
It's just, so why limited to just Godinez and Madison? Why haven't you been able to branch out to the other schools?
I actually do have already set up we're emailing back and forth for dates at other schools.
Okay.
But some of them wanted to wait until this year, so it's on my to-do list to reach out to the rest of them, and hopefully they'll invite me to come in.
Awesome. Thank you, Cecilia, LaShonda. Any questions, last questions? Seeing none? Thank you for your presentation.
Thank you.
Next up, can we please have Community Health Initiative of Orange County? And just a reminder, we are validating.
Thank you, sir.
Okay. Good afternoon, commissioners. It is a pleasure to see all of you. Some of you, I see you once a year, which is really nice. My name is Georgina Maldonado from Community Health Initiative of Orange County, and I am here to give you a detailed information about our grant proposal for these next coming 2 years, which I have to tell you, for us as nonprofits, and I think I speak on behalf of most of us, is a 2-year proposal. It helps us with our capacity within our organization because we're able to plan out our budgets accordingly over a 2-year period of time. So I want to commend you for that. It definitely helps us out. But just to go back to our mission is to connect all children and families and other adults to affordable and quality healthcare and social services. The need in Santa Ana continues to be of high priority, not only for us as an organization, but overall as a county. According to the OC Healthier Together information that we were able to gather back in March of 2019, 33.9% of adults and 4.8% of children in Santa Ana continue to lack health coverage. Now, we have made significant strides with children because of the Medi-Cal expansion for the undocumented children that happened about 2 years ago. The adults still remain significantly high for 2 main reasons. One, because undocumented adults continue to have or continue to lack healthcare coverage. However, I do have a piece of data to share as I move on with the presentation. Additionally, 17.1% of families are continuing to live in poverty in the city, and as you could see, 45.2% are foreign-born. The lack of resources and familiarity with the English language, but most of all the healthcare system, even for us as individuals who know how to navigate healthcare services, the community that we serve continues to have a difficult time with managed healthcare in general. And so this creates barriers to care because even though most of our clients, as you notice, are insured, the navigation of services continues to be complex. The program that I can say that CHIOC was founded upon is the ORU model, which is the Outreach, Enrollment, Retention, and Utilization. The outreach component is the educational piece on how to spread the message on access to healthcare. The second piece of it is the enrollment, which is when a client shows up at our doors and at our sites to see an enrollment counselor and help them navigate on not only health services, but also other social service programs such as WIC, CalFresh, CalWorks. We work closely actually with KPOC on referral services for CalFresh. But another one of the components that also we add to the enrollment and retention is census information, earned income tax credits to put money back in our clients' pockets. And lastly is the utilization piece for our model, which is the navigation, which is the moment a client is effectuated for enrollment, it's not only, it's like, oh, it's great, we have our healthcare card, but how do we connect them to a primary care doctor, a specialist, if they have any type of chronic disease? Our efforts in Santa Ana, and I wanted to incorporate last year's numbers and also this current year's numbers, and I'll start with this current year. The goal is 750 Santa Ana residents to be served, and our projection is for this current quarter, which is actually due in the next couple days, is 250 residents with the goal of 750. Now, for last fiscal year, our goal was 937, and we actually did 1,193, which exceeds the goal by 256 Santa Ana residents. We have 8 sites in Orange County, including our site, which is open Saturdays. And all of our community partnerships are listed there. Orange County Opportunity Initiative, Santa Ana Resource Network, Orange County United Way, which is again the Cali ITC program, and Census, as I mentioned. And the proposal for this current year is, for this next fiscal year and 2022, is about 1,400, 1,500 residents per year to be served with the current request of dollars. Thank you.
Thank you. Good timing.
I know. I practiced, Cecilia.
That's good.
I want to start with you.
Okay. I'm not sure about the particulars of how city funding being spent on non-residents goes, but I'm more concerned about the population of citizens that you're addressing and the hurdles that they are encountering to getting health care. What service does your entity provide that Medi-Cal's case management as well as other healthcare case management does not provide?
It is the hand-holding of the process. So when you have a let me be a little bit more specific so as we speak, January 1st, the state of California has approved the expansion of Medi-Cal for young adults between the ages of 19 to 26-year-olds. As we speak, a 20-year-old is on restricted Medi-Cal, so they only have emergency services for their healthcare coverage. Now with the expansion of Medi-Cal, because they've never navigated a managed care plan, we need to educate them and walk them through that process on how to select a primary care provider. How do you access your hospital? What is the difference between urgent care and an emergency? That's how granular our services are, and that's how specialized we are able to educate our clients for that.
Okay. And you said that you hope to reach 250 residents. How many non-residents do you plan on reaching over the year?
Oh, no. It's for this current fiscal year that we were awarded, in the quarter we plan on reaching the 250. For the following 2 years, it's approximately 1,500, give or take.
Okay, so is that I'm trying to look at the demographic makeup
Sure.
of who you're serving. And I'm just curious, is that residents of Santa Ana in the United States, or is that residents of other countries that are currently in the United States?
It's Santa Ana residents.
Okay. So 1,400.
It's 1442 to be exact.
Okay.
Yeah, it's 1442 first year, 1449 second year. And again, it's give or take, and this is based on a projection based on the funding that we are requesting. Now, if the funding is less or is more, we adjust the goals accordingly, like we've done in previous years.
Thank you.
Thank you very much.
Thank you. Commissioner Garcia.
Just wanted to thank you for your presentation. I'm very familiar with the nonprofit.
Thank you
for your work, and thank you for breaking this out, the numbers in terms of how you're going to serve Santa Ana residents. I appreciate that. Thank you.
Commissioner Perez.
No questions, thank you.
Commissioner Tardy.
No questions, thank you.
Commissioner.
Great presentation. Thank you so much. No questions.
Thank you so much.
Thank you. Have a great evening.
Thank you.
Thank you. Now, now we're going to have our community legal aid SoCal. Please, can you come to the podium? Georgina, don't forget to get your ticket for the parking. Do we have anyone representing Community Legal Aid SoCal?
I hope so. I already have questions.
Staff? They're not here yet? Okay, then we're going to go into Community Senior Service.
Are they here?
Who's here?
So the next person that's here will be Delhi Center, Albie.
Oh, okay.
Can you give us like a couple
We
minutes so
jump
we
to the
can
other one.
grab that?
They're not here. The other persons are not here?
Not yet.
Okay.
We're gonna take a quick 4-minute break.
They were all made aware of their time.
They can wait. They're not gonna do it until 5:15.
Here on behalf of Albee, Delhi is on their way, but I can begin with the Albee presentation. I'm the executive director of Albee.
Thank you. Yes, you can start, Ms. Hila.
Thank you. May I begin?
Yes.
Okay. So we do have, okay, sorry. We do have this video. It is narrated, but we tried working with the sound. You're not going to be able to hear it. So you get the live narration with me today. Okay, so this is just a video of the camp we produced for Thanksgiving. We do camps on the school breaks, so Thanksgiving, winter, spring, and just with Thanksgiving alone, our 3-day camp, we were able to serve 79 unduplicated students. We recently just did our winter program, and we have exceeded over 90 unduplicated students. Those numbers are still being worked out, and they'll be included in our quarterly 2 report. Within our camps, we produce musical theater shows that come together with a moral lesson. So for Thanksgiving, we really honed down on being grateful, and each student got to also create their own vision and dream boards for their future goals. For our winter program, we focused on more of a historical piece. We took the 1920s and compared and contrasted with the 2020s. So they got to learn a little bit about the era of the 1920s, and then also got to do future goals for 2020. We also added a piece this year of DJing. So a handful of the students were able to learn skills in DJing, which was very exciting for them. And during the production, they actually performed that for their parents. Our students spend hours doing social emotional classes, art, prop design, and dance, drama, and then DJing was the other element. We also partner with the school district, so we get to feed them breakfast and lunch, and we also give them snacks throughout the day. They're there from 7:30 a.m. up until 5:30 p.m., and they stay the whole time. So for for Thanksgiving, we also include a parent component with all our camps. Thanksgiving, we brought out Cal State Fullerton. The nursing department came and did nutrition workshop, and we invited all the families to partake in that. So parents were involved in that. During winter, we had Dance with Your Child Day. We didn't get as much of the outcome as we wanted for that. But for spring, we're hoping to do some take-home projects, because those have been very successful in the past. And that's about it.
Thank you. I'm going to start with my left with Commissioner Calderon. Sorry. Thank you.
Thank you for the presentation, and I really appreciate the video. No questions right now. Thank you.
Thank you.
Thank you for your presentation. I don't have any questions.
Thank you.
Commissioner Perez.
Thank you,
Excuse
sir.
me,
Appreciate it. Thank you.
Yes.
Of the 79 students during the Thanksgiving break that you served, how many of them did not, was this their first time at the Delhi Center?
Yes, this year for our grant, yes, this was their first time, 79. So we actually had 97 sign up, but 79 came.
And those 79 do not attend Delhi Center?
No,
So those are 79 new?
unduplicated, yes.
Unduplicated?
Yes.
So they've never received services at the Delhi Center?
Not this year, no.
Not this year.
Yeah.
And then on the Christmas, on the 90, how many of those were unduplicated?
We actually had 100 signed up. I know that we've exceeded, at this point, over 90 unduplicated. Those numbers are still being crunched. We had some technical difficulties with, I was just talking to Mikkel yesterday, actually, with the sheet. So we had to start all over. We'll have those numbers by tomorrow.
Okay. So you're thinking those 90...
We've already exceeded 90 unduplicated, I can guarantee that, but I believe it's over. I just don't want to say what I don't have.
No, absolutely. I'm just looking at your proposal, and your proposal talks about your partnership with all of these additional schools, administrators from Monroe, Acadia, Madison, Kennedy, Pico, Lowell, Washington, Henninger, King, Garfield, and Davis.
More schools, so we actually have partnerships with all SAUSD schools, including all the elementary and intermediate sites, as well as a handful of the high schools. And those are the students that come to our program.
Do you guys have an MOU with Santa Ana Unified?
We have an MOU. We also have a partnership with the Santa Ana Unified School District. We provide enrichment services in musical theater, dance, and DJing for their Engage 360 after-school program.
And through the 360 program.
So we promote, that's one of the ways that we promote these camps. Other ways we promote is we're largely out in the city at community events.
Perfect. So all of the students that actually attend the program at Delhi, I know last year you guys partnered up with Delhi. Previously you ran your own program.
Yes.
So that's why I'm just trying to bridge these gaps. So of all the students that are attended, these are all new students, not duplicated, that have received services from the Delhi Center.
Correct. This year, yeah.
This year.
If we're talking about this year.
Yeah, just
yes.
this current
These
year.
are
Because I
all
know those
unduplicated at this point, yeah.
Excellent. And then how long are the camps run? Are they 2
They're
days, 3
very
days?
short. So each camp runs along with the school break. So for Thanksgiving, we only did 3 days. Winter, we did a total of 6 days. And for spring, we'll do a total of 5. They're short, but they get filled up.
And what's the time frame on that?
7:30 a.m. is drop-off, and pickup is 5:30 p.m.
Perfect. Thank you very much.
Thank you, Commissioner Perez. Commissioner Frazier?
Thank you. Thank you for the presentation and the video. Do you find that most of the participants are students that are already on a path to an entertainment field, or that are students that this is something that's new and engaging for them?
You know, it's a little bit of both. It's actually more of the students that we receive this is new and engaging. Some of the comments we get from the parents is, I've never seen my child be so involved in a program. So it's just something different because they're moving, they're active, they're also bonding and making social emotional connections with other peers. So we see these students out in the schools, and their personality is very different when they come to our camps because they're actually lively, they feel comfortable in the setting. Then when we see them in the schools, they're more quiet and introverted. So that, for them, that's very new and engaging. We do have students that have a high interest and they want to do this in their future, but we learned, especially this year during the Thanksgiving when they did their dream and vision boards, that a lot of them want to become doctors, lawyers, detectives. So this is not a path of their future profession, but it's just something that they love to do.
Okay, thank you.
You're welcome.
Commissioner Garcia?
I do not have any questions, just thank you for your presentation.
Thank you.
Commissioner Garcia? Commissioner Aguilaga? Excuse me. I need more coffee this morning. What do you want me to call you?
I don't think I need a microphone. If you working together with the District of Santa Ana, did the District of Santa Ana, did you obtain funding from the District of Santa Ana from doing those programs?
For the Engage 360 program, that funding comes specifically from ACES. We've been providing after-school program with them since 2003.
So District don't give you any money?
Yes, that's funded through ACES, an after-school program. Yeah, none of the students or parents ever pay for any of the programming we offer.
Thank you.
Thank you.
Thank you for your presentation. Just one quick question. Have you considered expanding into, there's a shelter near the Delhi Center, which is the link?
Yeah.
There's students there. Have you made an attempt to do some outreach to maybe get those kids during like the winter season or summer season to come and take camp?
Yeah, only part of our outreach is through the Engage 360 program. We also do a lot of outreach in community events, and we canvass the neighborhood as well. So we're always...
Can you consider the shelter, the shelter that's just down the street?
The next door? We've put out flyers there and given out the information.
But I'm asking you directly, can you go and actually tour the link and reach out to those kids and give them the opportunity to come to attend one of your camps?
Yeah, we could. I believe we have. I believe we've gone there and given out flyers, but I can make sure that we do. Yeah.
Great. No further questions. Thank you for your presentation.
Thank you so much.
And for the other folks who are here today, I just want to make a quick announcement on this process so we're all respectful of our time. Each speaker will be given 5 minutes to present the proposal. Commissioners have 2 minutes for questions. Staff will notify both commission and presenters of their 1 minute mark, just so we can stay on top and on schedule. And also, we are validating. If you've parked here, please see our recording secretary for your validation. Thank you.
May I say one more thing?
Sure.
The Delhi Center is on their way here because they have a few other programs, and they do have a handout that summarizes all of the things I told you. So they'll be giving that to you also.
Great.
Today.
We look forward to the presentation.
Thank you so much
for being here this afternoon. Mr. David, can we please have Community Legal Aid approach? Thank you.
Who is this?
Community Legal Aid. They're the 4:30.
Oh, okay.
So they're a couple minutes. Do you have a presentation, ma'am?
I do. It's a short presentation.
Great.
I promise to
Awesome.
stay within the 5 minutes, 15 minutes, whatever it is. So my name is Yolanda Omana. I'm an attorney at the Community Legal Aid SoCal, formerly the Legal Aid Society of Orange County. I want to thank you for supporting our program. We are located in the city of Santa Ana. The money that you provide to us goes to help residents who are in the city of Santa Ana and also victims of domestic violence and other crimes. We have myself, who is the face of the Santa Ana CDBG grant. I also have an attorney who assists me. Her name is Valerie Vasquez, and a paralegal, Priscilla Carmona. The advantage of helping your residents is that it's ordinary for victims of domestic violence not to return, not to come back once they've sought the services, because either they're afraid, they've been threatened, they don't show up for one reason or another. We are able to reach out to the residents of Santa Ana to say, hey, did you forget your appointment? Hey, do you want further services? And if they say yes, we reschedule them. We've allotted spaces specifically for the Santa Ana residents, and also we've been recently approached from the city of Santa Ana to help with the Santa Ana Family Justice Center. So we will be providing services at the Santa Ana Family Justice Center in addition to the services that we provide at the Legal Aid office in Santa Ana. We will give your residents the opportunity to go to the Civic Center or to go to our office the Family Justice Center. Another nice thing about this program is that we provide holistic services to the residents. They might come for one thing, they might come for their restraining order, but they actually need a divorce, or they have a housing problem, or they might have an immigration issue. We now have an immigration unit. It's fully funded by other services or grants. We've got 3 attorneys, 2 paralegals, fully staffed, and I think that the money that you provide to us really supports your residents. We are on track. We had requested to do 32 clients. We're currently at 28 clients, and this is full services, which range from the beginning of a divorce to the end of a divorce. So they will walk out with a judgment, they will walk out with custody orders, they will get their spousal support if it's appropriate, child support, whatever it is, the restraining order. Unless you have any specific questions, I'd be happy to answer them. That's my brief, quick presentation.
Thank you. We're going to start to my left with Commissioner Calderon. I'm going to get it right tonight, guys. Just give me some time.
Right? You're good. Great presentation, honestly. Thank you so much. One of the questions that I wanted to ask is that when you assist the clients do you go with the client to the court? Or is it just resources, hey, here's what's going to happen, there you go?
No, it could go anywhere from counsel and advice to representing the client in court.
Got it.
And so it's the full service. We have some clients that are able to do things on their own. Okay. We have clients where if the opposing party is served and they're not going to show, or they might be incarcerated, we try to empower our clients. So obviously we're going to represent the person that has more need than the other.
Got it.
But yes, we do represent clients in court. We actually prepare their paperwork from beginning to end. We won't refer them out to self-help centers unless, of course, they need something today and we're not available today.
Perfect.
Okay.
Thank you so much.
You're welcome.
Yeah, thank you.
Commissioner Tardif.
Thank you for your presentation. How do you do outreach to your clients, and what are the requirements that someone would be able to be served by your organization?
So we provide outreach throughout all of Orange County and Southeast Los Angeles. We have different different units within legal aid that go out to the various places. In fact, I was just at the Santa Ana College, I think it was last month, where we did a complete fair and shared our services and actually saw people that walked in. The services that we provide are to people who are at or below 250% of the federal poverty level, are either a U.S. citizen, resident, and if they're neither of the two, then they're a victim of domestic violence. We can assist them under the Kennedy Amendment and the amendment to the Kennedy Amendment of the Legal Services Corporation rules. So the bottom line is they're poor, they're in the service area, and they have an issue relating to domestic violence.
Thank you.
You're welcome.
Thank you, Commissioner Tardif. Commissioner Perez.
Thank you for your presentation. I also just want to make sure all of our commissioners note that for the last 3 years, this organization has gone above and beyond all of their units of service and have surpassed them for the last 3 years. Last year, they were only supposed to serve 31. They served 53. The year before that, they were only supposed to serve 33. They served 44. And this population is an extremely vulnerable population. Thank you for the work that you do.
Thank you so much, and that is correct. I ditto everything Mr. Perez just said.
He is the man.
He is the man.
Commissioner Frazier.
Thank you for your presentation. Recently, I've learned that the difference between the amount of women who experience domestic violence from their spouses and the amount of men who experience domestic violence from their spouses is marginal. They're very competitive numbers. Is there a counseling component to your legal services that helps to address the stigma with men coming forward and talking about their domestic violence with their spouses?
Well, what's interesting is this is the first year that we've had a bigger number of male coming to our office. Men don't seek the services for various reasons. They're embarrassed, they're ashamed. I can't tell you why they don't come forward, but it most likely is for the same reason that women will not always come forward. Right. And it's not happening to me. I'm embarrassed, I'm ashamed. What will they think? Different reasons. But so this is the first year that we have a total of 3 going. I think we're starting with the 4th male, where we're going to assist from beginning to end, where that person, the male, is, you see the exact same thing that you see with the females. They come in broken and I'm not kidding, by the time they leave our office, it's like they've grown wings. They've ended this horrible relationship, but we're also trying to help them to learn to, or understand that there is going to be some continuing relationship with this person who is their abuser, because they share children for the most part. It's nice if they don't have kids, because then you can cut them out completely, but unfortunately the majority of our clients who are victims, and in the case that we have the 3 men, there are children involved, and they all have to deal with their abuser. So there's different things that we do. We lead them to resources. We give them resources. One of the main things that we do when they first come to us is look at what you can do to create a safety plan for yourself. So we're still developing things every day, and it's not the same thing for each person. Each person is unique. Each person, whether it's a family, whether it's an individual, has their own issue. And you can't just go in with this script and say it all fits into this. It's each person has their own, literally their own story.
Thank you. It's fantastic to know that you are addressing the other side of that coin. Thank
We are. Oh.
Commissioner Garcia.
I don't have any questions. Thank you for your
Thank you so much.
presentation.
Commissioner Aguinaga.
Thank you for your presentation. I'm very acquainted with your program because I've been in this position on and off for many years. You've been funding for many years too as well, since I remember.
Thank you so much.
Thank you for your presentation.
Thank you.
Great. Simple question. You know, a lot of folks who seek services kind of feel like there's a barrier due to status. Do you have to be a legal citizen to actually get services?
No, if you are a victim of domestic violence, whether it's current or you're trying to end the relationship, or it could be, let's say, an unlawful demeanor action, but it's based on, the eviction is based on having been victimized by your partner, then you do not have to be a legal permanent resident or a citizen of the United States.
Thank you for your presentation.
You're welcome. Thank you so much. Excuse me.
Mr. David, can you please report? Community Senior Serve, please.
Thank you.
And Madam Clerk, would you mind just taking time on commissioners? You wouldn't mind? Thank you. Thank you, sir. All right, good. That's fine. And just out of curiosity, or do you want to combine your 2 presentations?
Yes.
That's better. Okay.
Yes. Yeah, it's a. Okay. I'm Holly Hagler, and this is Delana Gutierrez. We're with Meals on Wheels, Orange County. Our parent name is Community Senior Serve. We recently rebranded. We were known as Senior Serve, and now we're known as Meals on Wheels, Orange County. So we're glad to be here. And so I'm. So our mission at Meals on Wheels C is to nourish the wellness, purpose, and dignity of older adults in the community. We're celebrating our 52nd anniversary, and we've been here forever. We've been working in Santa Ana forever as well, and as I mentioned, we recently changed our branding. The programs that we provide overall as an agency are Lunch Cafe, and that is one of the programs that we applied for. We also call that the Congregate Lunch Program. Meals on Wheels, which includes case management services for everybody that receives Meals on Wheels. Friendly Visitors, Adult Day Health Care Centers. This is not part of our application today, but we operate an Adult Day Health Care Center in Santa Ana as well. We operate one in Anaheim also, and care management services across the county. In general, we operate across the 20 cities of Central and North Orange County, served about 834,000 meals last year, and we served about 92,000 meals to Santa Ana residents last year. Have over 700 employees and volunteers. I wanted to point this slide out to you because it's a really key slide for what's going on here in the demographic in Orange County. And the older adult population is the only demographic that is growing. Every other demographic in this county is declining except for older adults. So that wave everybody's talked about has fully arrived. Food insecurity is a really key issue here. 22% of low-income older adults in Orange County are food insecure. That's what we address. And food insecurity means they have limited or uncertain access to food. And contributing factors are social conditions. For older adults, reduced mobility. They just don't have the ability to maybe go out and shop and cook the way they used to, and can fall into malnutrition as a result of that, and then obviously health conditions as well. Our Lunch Cafe program provides hot, nutritionally balanced meals at 2 senior centers in Santa Ana. We operate across 20 cities, as I mentioned, but we're at the Santa Ana Senior Center right down here, downtown, and we're also at the Southwest Senior Center on West McFadden Avenue. It's a donation-based program, suggested donation of $3 a day, but we actually collect much less than that, and so we have to offset for that. It costs us far more than that to put the program on as well. And we serve the meals Monday through Friday to any older adult who is age 60 or over. That is the only requirement for the program. All right? When they come to the senior centers, they come for the lunch, but socialization is a really critical part of this program. And so they might join in, we have a lot of dances and things like that as part of the lunch program, guest speakers, but they can also go to start playing bingo, volunteering. So the idea behind this program is it gives them a reason to get up in the morning, get dressed, go out, talk to people, interact, and stay engaged, which is super critical for older adults not to fall into isolation and loneliness, and then it's a downward spiral from there. In Santa Ana, we serve on average 78 older adults a day in the Lunch Cafe program across the 2 sites. The average donation is $1.23, and we served 19,000 meals to 802 unduplicated participants. Our goal in for CDBG, and this is HUD eligible. I want to distinguish between all of our participants and HUD eligible. So while we serve 802 unduplicated participants, our goal is to serve 500 HUD eligible, which means they have to be age 62 or over, and they have to agree to fill out the paperwork that documents that. We don't require the paperwork in order to come and eat in the program, but in order to be counted on CDBG, we have to have the paperwork, okay? So the program is actually much bigger than that, but that is what we've identified as the HUD goal. So gotta meet those HUD audits. Those are really key. The outcomes, we do measure outcomes. And 85% of the attendees attend the program at least once a week, most of them much more often. 74% feel the meals keep them healthy. This is what they tell us on the surveys that we do. And 47% say the socialization, the friendships makes the going to the senior center a special part of the day. So that's the Lunch Cafe program. Delana will talk to you about the Meals on Wheels program, and then I thought we might take questions. Does that work for you all?
Sure, you're on 3 minutes for the second presentation.
Okay.
Just a FYI, Diana, please proceed.
Oh, I just want to tell you about Eleanor. Eleanor would be one example of a client who comes to the program and who was homebound before she came and has become much more active.
Thank you.
Hello, thank you. I just wanted to start by expressing our appreciation for the funds that we have received and the difference that it's made in our seniors' lives. We are most well known for the Meals on Wheels, which is our home delivered meals program. What a lot of folks don't know is that it also comes with case management, where our case managers go into the homes of our participants. Most of our participants, or I'm sorry, all of our participants receive 3 meals a day, 5 days a week by paid and volunteer drivers. And that includes breakfast, lunch, and dinner, which is reviewed by a registered dietitian. So it's a nutritionally balanced meal. The suggested donation is $5.25 a day, and most of our participants are homebound, as Holly mentioned. These are participants that maybe can't make it to the congregate site because they have mobility issues or health issues, and they have difficulty shopping, preparing meals, maybe issues with sight or memory. We're currently serving 87 seniors in Santa Ana by the paid and volunteer drivers, so we're delivering meals to them. And the average donation that we are receiving is only 20 cents a day compared to the $5.25 that we need, so it doesn't cover all the costs that we have. We served 74,400 meals to a total of 131 clients in Santa Ana. A couple of outcomes from the surveys that we have done. 93% feel their situation is better because of their case manager's help. Quarterly, our case managers are going into the home and being able to assess the needs of the person and qualify for the program, but also see what other services they might need. 86% feel that HDM program is extremely important in maintaining their independence. The idea is to keep them out of hospitals and assisted living facilities. And 84% feel the program is extremely important in impacting their overall health. Marta's story. So Marta came to us in December of 2016, and she was hospitalized several times due to back surgery. She actually received, in addition to our meals, she received in-shore, in-home services, and case management services. She doesn't get any help from anyone outside of Meals on Wheels Orange County, so she lives completely alone, and she suffers from several health issues, including COPD, CHF, congestive heart failure, and kidney failure. After being hospitalized several times, one of our case managers, Lan, visited her and found that she had dropped to 85 pounds. From there, he was immediately able to supplement her meals with inshore and get her on the track to recovery. She's also a recipient to our holiday meals program, holiday gift program, and received female undergarments, pajamas, and a coat this past holiday season. She's extremely grateful and has called in to express her gratitude many times since the holidays, and we are thankful to be of service to her. In prior years, a little bit of history, Santa Ana staff handled the CDBG application in 2017, 2018. We have handled the application since then. And in the past years, we've been provided funds of $45,148 for each program, so that's a total of about $90,000. And we are submitting and requesting.
So I'm just going to clarify something.
48.
Here.
Sure.
Yeah. So let me just clarify. For the past 3 years, we've been receiving general discretionary funds from the city. I think there was concern, when in recent years, when there were talk about cutting CDBG, that they didn't want these funds to be impacted, was my understanding. So the city council provided the discretionary funds to ensure them. CDBG looks like it's continuing to be maintained, and so we were asked to return to applying for the program and to apply directly. Whereas I mentioned staff had already applied for it on behalf. So
thank you, Holly. We're kind of short on time. Okay. We're going to go for questions. I'm going to start to my left. Can I get Commissioner Calderon?
Thank you. A very thorough presentation. Thank you both for the information provided. No questions right now. Thank you.
Thank you for your presentation. I don't have any questions.
Commissioner Perez.
Thank you for your presentation. Great program. Thank you for all the hard work that you do. No questions.
Commissioner Frazier.
Thank you for your presentation. I just have a couple of questions just so I can understand some things. On your lunch cafe outcomes, the 85% that attend the program at least once a week, what are the other 15%? What are their they have a hurdle to attendance, or do they have
Sometimes they come, a lot of people like to come for parties. So we always celebrate the parties, Mother's Day, holidays and things. So a small number are coming for special events. So that may be it, or they may be coming as a guest of somebody. But the regulars, and really there's many people that are coming, 3, 4, 5 days a week. It's core, and it's maybe the only hot meal that they're getting.
And my other question was, you mentioned that you want to reach 500 HUD eligible individuals. How many HUD recipients do you serve?
As an
That
agent?
actually receive HUD?
Well, we would measure those people who are eligible according to HUD guidelines for the congregate program. So if they don't meet those guidelines, we're still serving them. That was the difference between the 500 and I think it was the 800 that we serve.
Yes.
That's the difference. We only measure HUD eligible in cities where we receive CDBG funds because it's the only time it's relevant. Because otherwise, anybody age 60 or over, we're going to serve them, but to get CDBG credit, it has to meet those very clear guidelines. And I would also mention 90% of the people that we serve are below the Elder Poverty Index.
Thank you.
Commissioner Garcia?
I do not have any questions. Thank you.
Commissioner Aguinaga?
I do not have any questions. Thank you for your services.
Thank you.
I would like to share with the commissioners that I've actually had the pleasure to tour your facility. I know that I've had a meeting with Susan Paprini. We actually went out and delivered some meals, and one thing she told me, which was really impactful, was the drivers who go out and actually drop off the food, they see whether they've been eating the food, they're consuming the food, they're not consuming the food, because that right there is like a red flag, whether their health might be in question or if they're feeling depressed. And also, something I also want to share with you is that you offer a volunteer, to come, it's like a buddy system?
Friendly visitors?
Friendly visitors?
Yes.
And their commitment is not much. I think it makes a big difference when someone pops in and talks. And then, as Ms. Aguinaga said, and I have Mr. Tardif, we have 2 potential recipients here for Meals on Wheels.
Wow.
For $5.50, you don't have to worry about the grocery store.
I may need you, so make sure to leave your car. Thank you.
No problem.
Thank you for your presentation.
All right. Thank you very much.
Thank you.
You said it, man.
Commissioners and city staff, just want to make an announcement that I'm going to be heading out. So thank you for your time and good luck to everybody. Thank you.
Thank you, Commissioner Calderon. Mr. David?
Take care, Miguel.
Thank you.
Can we please have the honorary Delhi Center please approach? Let's do the Delhi Center Public Law Center if possible.
Good evening, everybody.
Great.
Before we begin, I'm not sure if Hiba mentioned, I know that she went on before I got here, but I do have some handouts from that presentation that might be beneficial to all. So I'm going to hand these to you. Thank you.
Oh, sir.
And I also have a printed version of the PowerPoint presentation for today. Thank you.
You can start.
Oh, great. Hi, everyone. My name is Patricia Gonzalez. I am the Director of Operations for the Delhi Center. Ms. Jenny Rio sends her regards from Europe. She's on vacation. And with me, I have Nancy De Leon, who's our case manager for the Family Economic Success Initiative program. And also with us, we have Sarah from the Public Law Center as well, just in the event there's any questions that she might be able to answer. So we can go ahead and proceed. Will I be directing the PowerPoint here? Oh, okay. Great. So we wanted to start off with the experience, with the Delhi Center's experience in financial stability programs. It goes back to when we incorporated in 1969. In 2013, we formalized the program through a partnership with United Way and became a Smart Point site where it was like a hub where we would be able to service the clients and refer them to different programs based on the needs, financial needs, help them increase income, manage credit, build assets. And then in 2016, that's when the program ended, so that's what we have on the slide. We have a couple examples of what we were able to accomplish in 2016. We had 56 active clients, 42 of them open savings accounts, a total cumulative savings of $175,000. So a lot of great work. And then in 2018, CDBG funding allowed us to restart and revamp our program. Between 2016 and 2018, we weren't able to offer as much, but we still offered different, at a smaller scale. We offered consumer protection workshops, helped lower cell phone and utility bills, things like that. But in 2018, CDBG funding allowed us to ramp up the services again, which is awesome. And now we are now in our second year of the CDBG funding. With the Public Law Center, they've been providing services to Santa Ana residents since 1981. In 2018 alone, they provided over 65,000 hours of free legal services and have served over 4,500 cases, as you can see. So there's a lot of very important information that you have in front of you, and I'm reading off of it, but it's really good to note that they've handled almost 70 cases, which include predatory lending cases, creditor harassment and debt collection cases, bankruptcies, all services that would also be a benefit to the Delhi Center clients as well. And Public Law Center's large network of partners provides free legal services and other supports. That is why we decided to merge this year in order to better meet the needs of our Santa Ana residents. Listed are the outcomes for the first 6 months of our current CDBG grant-funded program, which is our second year, as mentioned. We have served 113 clients so far, which more than half have met with the case manager, Ms. Nancy, to plan out their goals and identify areas needed. We've also, 11 of them cumulatively increased their income by $29,000. 8 have cumulatively reduced their debt by $11,000, and 19 have increased their savings by $32,000. So as you can see, there is an impact there. This next slide lists additional outcomes in our current cycle. 36 clients have completed 2 financial workshops where they worked on their credit and budgets. 107 of them have completed 2 consumer protection workshops. And you can see some of the income support services our clients have received from the last 2 bullet points, receiving school supplies, backpacks, toys from our holiday gift giveaway, but also the referrals taking place to ensure they receive more than what the Delhi Center can offer. And that is what our big next step is, being able to be of service not just in a couple of the areas, but expand many more areas where we can help them overcome obstacles. So referring our clients to services, resources, and care is our strategy to a successful program by having a bundle of services. The clients are prone to success when the more services that we're able to provide, the more successful they can be. And they face a lot of challenges, which brings us to the next slide. This is who we serve. The majority of our clients are extremely low income and Hispanic. Approximately 52% of the Delhi clients have a median annual household income of $25,000, and 64% live in households with 5 or more persons. 34% of them rent a room, and 54% use predatory lending services, have used in the last 12 months. So we do serve the hardest to serve families, as you can see, and that is our goal, to continue to serve them and just help them be successful in all these areas. The next slide is our service components. We identify the appropriate services and bundle them for each individual client based on their unique need. While many FES clients have improved their economic status, they feel stuck. They feel stuck because of legal issues that currently, before Public Law Center came into the picture, we wouldn't be able to assist them with. So we would assist them with the other financial and business and goal settings and whatnot, but they still felt stuck. So having the Public Law Center supporting us in that area will allow them to become even more successful, to do so much more. To address this gap in all these areas, as I mentioned, We help them with income support, financial stability, workforce development, business development. We've added to each component the legal services. This next slide is a ladder of success of where we see our clients. Our initiative is designed to help families move up the ladder of success, as I mentioned, but unfortunately, the majority are in the crisis stage and vulnerable. The process is time-consuming, but with patience and partnerships like the Public Law Center.
Due to time, we're going to open up to our commissioners, then we can ask some more questions. But we do have your handout. Thank you so much.
Perfect.
And we've reviewed your application, so we're not cutting you off completely. But I'm going to start to my left with Commissioner Garcia.
I do not have any questions.
Thank you, Commissioner Garcia. Commissioner Tardif.
No questions. Thanks for your
Mr. Tardif.
presentation.
Commissioner Perez.
Yes, thank you. So last year, you guys actually received $71,568 to serve 110 clients. You did not meet your units of service. You only reached 94. Last year, this board was very adamant of units being served. So I'm actually a little shocked because Public Law met their numbers and exceeded all their numbers. And you're coming before us for additional funds when last year your numbers were not met. Why were your numbers not met last year?
As I mentioned, it's a very time-consuming process. Meeting with each individual client, only having one case manager for 100 can be time-consuming, but as the program has progressed, we have implemented other systems to help smooth out the process. But as far as last year, that was one of the challenges. It's just having to usher each client by the hand and walk them through and take them step by step is just very time-consuming. And as mentioned, they have a lot of obstacles, so that was our main challenge.
Again, I'm going to argue Public Law met all their numbers, exceeded their numbers. Same population, same service provider. So just want to take that as a note. Thank you.
Okay.
Thank you, Commissioner. Commissioner Frazier.
I'm big on units of service per person, and the amount of counselors to clients is a really big thing, because what I see a lot is there's never enough counselors to address the community. And to Mr. Perez's point, what are you implementing this year that you didn't implement last year that will help you meet or exceed the numbers that you've promised us this year?
I'm glad you asked that question. Another body. We have now the budget for a client advocate that is assisting. Yes, now we have two.
Two, so that would be 50 clients per each counselor.
Possibly more.
Okay, and you're wanting to bring how many clients on?
Well, as of now, we have 113. We're midway, and our goal is 110 or 125? 110, and we've already surpassed that.
Okay, so you're really, I see what you're doing, but it sounds like pretty soon you're going to be right back in the same position to where you have two counselors each now handling 100 clients. And that's what I'm concerned about, because if you haven't made the numbers beforehand and you're setting on this path, I'm curious how that works. That doesn't make sense to me.
Well, the numbers are, we're still going to, because our goal is 110, but now we have two, where before it was 110 and we just had one. So.
But you've already exceeded your goal of clients. Now you're at 120, and I'm sure that will increase. And as that increases, that's going to reburden your counselors. So what is your plan for that?
Well, I believe that our goal is still to continue to work with the same clients, and then the next program year, either they continue the program or we bring on new clients as some are exiting. So it's not, we don't keep the clients forever unless, of course, they're still need that assistance. We would still service them. But as mentioned, now we have two for 110 clients, and we're right on track. There's no concerns.
And last question. How many of your clients do you refer out to other services?
I'm sorry?
If they're not able to meet with a counselor and they have needs, how many of those clients do you end up referring out to other services?
Every single one of the clients meet with their counselor, and depending on what those needs are, we refer them to those services. So they're all touched. There's always a contact, and we do make sure that we do refer them out where needed.
Thank you.
Commissioner Aguinaga.
I just have one question. How do you plan to advertise your services so you can meet your goals as you did not meet the goals last year?
Word of mouth has been one of the biggest gems for the Delhi Center. As mentioned, we're already at 113 clients. As far as for next year, same, you know, we have, I think we're in the process of starting a waiting list, but yes, that's word of mouth basically.
Really?
Of the great service.
That doesn't work very well, Mija. You gotta do something else. Anyway, just a suggestion.
Thank you.
Thank you, Commissioner Aguinaga. I'm a big fan of the Delhi Center. I see what you guys have done throughout the whole year program. It's a really busy center. It's very vibrant. You're on the south side of the city corridor, and we're seeing a lot of parents utilize the services, the seniors. Also feel that it's important that we continue to support our business development component. It's sometimes very daunting because there's a lot of steps, and I can understand. I don't know, Nancy, you want to take a quick 30 seconds to talk about, some of the hurdles you come across when it comes to case management, and sometimes, please, you have 30 seconds.
Yeah, so for the business development, it's very hard because we're talking about families that are working, that have families, that have 1 or 2 jobs. Possibly they don't have the time to be able to go back to school or be able to have that money to be able to start, getting that money to be able to get all those permits. Also, working with the county has been very difficult back and forth with all the permits. So that's kind of, that has been difficult in regards to the business development side of it.
Thank you, Nancy, and I hope that I encourage commissioners to go to the Delhi Center and maybe speak to the small businesses, and because I feel like, like Commissioner Aguinaga said, word of mouth, it may not be as effective. There's probably an aspiring baker out there or someone who wants to launch their business, so maybe thinking a little bit outside the box, working closely with the city, and then also allowing us to see how we can help, or how, please paint us this picture so we can, I'm going to pass it on to Commissioner Perez.
And I think this is, for everyone really in attendance, our CDBG funds is a small amount of money. We're going to have to turn down $2 million worth of proposals. And we have multiple agencies that work with the same population and have met their numbers. And I think that's the hard part, because believe me, I would say the Delhi Center has been a pillar in this community and has helped the community. And I was actually shocked when I reviewed this, because this is not typical of the work that the Delhi Center has done. So, hopefully you guys can take care of what you need to, but I will tell you, it will be a very difficult decision moving forward.
Thank you.
Thank you, Commissioner Perez. Next, can we please have the Delhi Center, not the LB, Teen Engaged. Just a quick announcement as well. We are validating. If you have parked in our parking structure, please come see the clerk for your validation. And a quick reminder, each speaker will have 5 minutes to speak to present their proposal. The commission will have 2 minutes to
We're going to start off with the video.
I just gave it to him too.
Thank you.
Yeah, the air blows right through it. And it's the only place that it hits.
They get you on the lights, it warms it up here.
Mine's in the car. Thank you.
Nice to have you close by too.
We're ready when you're ready.
Okay.
Yeah.
So we just want to share this story, and then I'll proceed with the PowerPoint.
who lives in the Delhi neighborhood. When he was a freshman in high school, he made a decision that would change his life. He decided to go out tagging with some friends. His little brother was with him at the time. They had to do community service hours and were placed on probation. Being on probation has changed Juan's life because it led him to where he is today. He tried different places to do his community service hours, but nothing worked until he found Delhi Center, where he completed his hours while learning skills that are helping to guide his future. Juan decided to stick with Delhi Center and join the teen program. He volunteered with Winter Camp, which served over 120 children. Juan taught classes on team building and leadership development to help the participants build resiliency to avoid gangs and drugs. He volunteered at the U.S. Toy Collaborative with other teens to sort out an entire warehouse full of toys. It was fun and rewarding, and because of that, Delhi Center was able to serve about 500 people during the holidays. When the employees from Pacific Life Insurance Company donated 178 Easter baskets, Juan helped sort and distribute Easter baskets. Juan also volunteered at the Trunk or Treat event, which provided Halloween treats, door prizes, and a costume contest for about 400 people. Juan was recently hired as a customer service representative for Delhi Center, where he learns new skills every day. His career goal is to be a psychologist to help teens who are in trouble with gangs or in school. He doesn't want anyone to experience what he and his little brother went through. He wants to change neighborhoods, and he feels he's getting a start on that right here at Delhi Center. Juan is thankful to everyone who has supported the center, and he believes that together we can make Santa Ana a better place to live.
Which now leads us to the PowerPoint presentation. I wanted to start off with the success stories. As you've seen, he is just one example of the many changes that the teens go through and experience at the Delhi Center through the internship program, through the TEL program. This is Ms. Myra Torres. She's the program coordinator for the TEL program. She actually also started as an intern 4 or 5 years ago with the Delhi Center and is now one of our most valuable assets at the Delhi
Can we pause the clock really quick? Ms. Meyer, you can go ahead and talk to us. We don't have to go through the whole handout because we have it here with us. If you just want to speak, because you only have about 2 minutes and 45 seconds, I want to make sure you have enough time to talk about your program. Thank you.
Okay, so thank you for having us today. And then, like Ms. Patricia was saying, this is Juan Torres, who started last year and now is one of our employees. I'll go ahead and start with the presentation. So we just wanted to share the success stories that we have. Just like Juan, we have many other teens that started like him, needing the guidance. And in the PowerPoint, you guys can see, we have 3 of the teens who graduated high school last year, and they received help from the Delhi Center. We helped them through FAFSA. We helped them fill out the FAFSA. We helped them, we had mock-in interviews, and now 3 of the teens are graduating from high school. And the teens that have already been through it, they come back and then teach the new teens that are experiencing that. On the next slide, we have our current teen interns have accomplished in their first 6 to 8 months, and they have completed a total of 1,179 hours. And you guys can see in the pie chart a breakdown of the activities that they have done. They have, with internship being 798 hours of internship, and there's a few of the activities that they have done. A lot of the community events that we've had. For example, we had our trunk or treat. We've had a holiday event as well. So this is just a little bit of what all the teens do throughout the year. On the next slide, we have the skills that the teens have learned. They have learned communication skills. That's one of the biggest one that we work with the teens to not only they also experience being in the front desk, greeting customers, answering phone calls, so they also get that experience as well as work with other mentors or other staff members that are at the Delhi Center.
Thank you, Myra. I'm going to go ahead and open it up to our commissioners. Commissioner Frazier.
Thank you for your presentation. The Thanksgiving camp that's on this Active Learning and Believe and Inspire, is that the same thing as Turkey Camp?
Yes.
Okay, so that has.
Have you been to Turkey Camp?
Huh?
Have you been to Turkey Camp?
I have not. I have not. It looks interesting. I've kind of read a little bit about it. So that is passed, right?
Yes.
Okay, so how many people, how many contacts did you get for gang prevention and classroom training?
For the Turkey Camp?
Well, you said that you would have that information after Turkey Camp on your presentation.
Is there a page number?
Actually, yeah, that was already 42. They did 42 hours.
42 hours?
Yes, only 2 of the teens met the 10 contacts that they're supposed to do, but we had 6 teens that completed and were participants of the Turkey and Winter Camp. We're combining them.
I don't have any other questions. Thank you.
Thank you, Commissioner Aguinaga.
Me?
Yes, ma'am.
You changed the.
Switch it up.
No, it's going this way.
I'm very acquainted with your program, Flo. Thank you so much for the presentation. Thank you.
Thank you, Commissioner Aguinaga. Commissioner Garcia.
Thank you for your presentation. I have no questions.
Commissioner Tardif.
Thank you, no questions.
Commissioner Perez.
Very well written grant. As I am hard on those that don't meet, I'm also very rewarding to those that are doing a great job in meeting their numbers, and wanted to see and tell our commissioners they're exceeding their numbers in this category, in this area. So continue to do a good job. Very impressive. Thank you very much.
Thank you.
Thank you, Commissioner. My only comments or remarks would be if we can outreach to the Link shelter that's just down the street from the Delhi Center. You know, I know there's teens who are facing homelessness that just need like a place to plug in and be part of. And so I know that this side of town is also a challenging side of town, but if we can just, like we said, kind of expand a little bit more and see how we can better get those youth off the streets and into a program that will better help them in their future. Thank you for your presentation. City staff, we are going to break the rules just a little bit. We're going to have Girls Inc. come up since they're here in the audience. That way we can get her squared away, and then we'll go on that break. Can we please have Ms. Santana please come up?
Good evening.
Girls Inc.
All right. And I have joining me today Jessica Hubbard, who is our Director of Program Services as well. So thank you for the invitation to join you here today. Like I said, my name is Lucy Santana. I am the Chief Executive Officer for Girls Inc. of Orange County. I've actually been with the organization. I celebrated my 20th year last year, and the organization overall is celebrating 65 years in Orange County of inspiring girls to be strong, smart, and bold. The evolution of our programs has been really important and really key to us because we have, in our history, always focused on girls. And we really feel that that is an important job that we have to do because we want to make sure that girls have access and opportunities and that they are seeing female role models, that they're being mentored by females, and that they are being able to see the world outside of their own realm at home. So a couple of things of who we are. We're serving about 44,000 girls a year throughout Orange County. Our model has always been that we work with the schools. We actually go into school programs, school sites, and work directly with the administrators. We really feel that it's important for us to go to the girls. Our background is that we actually were an original girls club of the Harbor area in Newport Mesa, but since the 1980s we've been countywide, and so we serve all girls in Orange County. What's important for us is that myself, actually, before my 20-year tenure here at Girls Inc., I actually worked for the City of Santa Ana for about 9.5 years. My experience has really been in working with Parks, Recreation, and Community Services and doing gang prevention programs. For some of you that are familiar, I worked with the Project Pride program for many years, and so understand the work that is so important to making sure that these kids have programs that are keeping them focused and on track. And for us, it really is about ensuring that they're reading at grade level by the time that they're in 4th grade. So for us, focusing on this literacy program, it's a new program that we're bringing into Santa Ana. We've been doing it for the last several years in Newport Mesa School District, and for us, it's really key and important that we're doing and focusing on that. As well as for us, it really is about ensuring that we're also reaching out to the families. It's not just about serving girls, but it's about serving their families and making sure that it becomes a whole family affair. And so we wanted to share a little bit more data about our programs.
Thank you so much. The quote before you is, "Today a reader and tomorrow a leader." I love this quote because when we're working with our girls in the Literacy Lab program, we refer to them as leaders all the time. They are not just our girls, but they are leaders, and they know that to get there, they need to become strong readers. I have the unfortunate job of sharing some really bad data with you, so I apologize in advance, but I feel it is my duty to inform you, or at least remind you if you're already aware of this statistic, that 27% of the youth in Santa Ana Unified School District, that's only the number that are exceeding or meeting their grade level reading requirement for 3rd grade. That is the lowest in Orange County, unfortunately, if you're not already aware of that. And that comes from the 2019 Orange County Conditions of Children report. I have some more bad news. I apologize. Again, 44.2% of the youth in Santa Ana Unified School Districts are developmentally on track in all areas. That is another area in which Santa Ana Unified is the lowest in all of Orange County. Thankfully, I'm not here just to present some really bad news. I have some good things, and that is a solution. And that solution is in the Girls Inc. of Orange County Literacy Lab program. We have already been working with Newport Mesa Unified School District in providing our Literacy Lab program to get our girls reading at grade level. We begin in kindergarten, and by 3rd grade, they have completed that program, and they are making astronomical gains. Within your packets that you have a copy of the PowerPoint presentation. You also have an infographic that shares some of those outstanding numbers and data and those results. So working in partnership with SAUSD, so we've already identified 4 schools that are in high need and that we know can benefit from this program. Approximately 120 girls annually will receive this nationally recognized literacy programming. During the course of this program, they will receive 60 hours in a single school year. This content is internally developed, it is research-based, and it is comprehensive. The whole concept of SEL, social emotional learning, this was a thing for Girls Inc. long before SEL was a cool buzzword. We've been serving the whole girl, all aspects of the girl for years and years and years. So all of our work, while we are focusing on literacy, we're also talking about college, we are also talking about STEM, all areas and areas that will impact the entire girl. So it's a holistic approach with literacy minded. All of the books that we share with our girls are 100% female protagonists because when they're talking about a marine biologist, we want them to see a female marine biologist, female leaders. So when they see it, that's how they be it. DIBELS is used for all of our programs, so that's the measurement tool that we are using. This is the nationally recognized measurement tool, formerly known as DIBELS. Now they've changed to Acadience. All of our girls are tested, so the numbers and the outcomes that you're seeing on that infographic are those official DIBELS numbers and data. Our staff, our literacy experts that are working with our girls, our educators are all trained in giving DIBELS.
We'll allocate like 1 more minute. We have your presentation, and we'll go around and ask questions, so
appreciate
you have a minute.
So what we're able to do in this program is by working with these girls, providing them with this instruction, they're excited about reading. They're excited to come every single day. And if you struggled as a reader, or if you have children that struggled as a reader, you know that this is hard to find. So girls come running into the classroom, they are excited and ready to learn, and excited and ready to read. We are inspiring girls to not just be lifelong readers, but be lifelong learners as well, because reading is so critical. Some fast facts that I would like to share with you. There's a lot of great data that you'll find about how important, how critical early learning and early reading is in literacy. If we're talking about community development and improving a community, we believe you have to start with reading. The letter of support that you'll see there is from Santa Ana Unified School District, which also is sharing that if we want to improve a community, early literacy and reading is the surest way to improve a community. I'll share with you that increases in literacy lead to higher self-esteem, willingness to participate in community groups. That comes from the National Institute for Literacy. And most startling, 2/3 of students who cannot read proficiently by the end of 4th grade will end up in jail or on welfare.
Thank you. I'm going to open up for our commissioners for comments. Commissioner Frazier.
Thank you for your presentation. This seems like a really fantastic program. But what I'm curious about is I noticed that your statistics switch. You're a girls first, girls only entity, but you're using youth students as your statistics. So out of the 27% and out of the 44.2%, how many of those are the girls that are affected by those statistics?
So that data that we're referring to, that's coming from the Orange County Commission of Children report. So
Right.
unfortunately, they do not separate it by gender. So that's just youth as a whole. Our data that I'm able to provide you with are the girls that we serve and the youth that we work with. So those would be exclusively girls.
So those girls, what is the percentage that equates to, let me make sure my verbiage is correct. So out of the
Let me help you out. Just historically, being in education, historically females are actually significantly lower than males in literacy. So even though they're giving you a number of 27, I'm going to argue in Santa Ana it's probably going to be in the low teens. So historically, the female population, for unknown reasons, scores significantly lower than males. So if they're given a number of 27 and they don't break them out by gender for academic stats that way, but I would argue they're significantly going to be lower than that.
Okay.
Thank you, Commissioner Perez.
That's what I was trying to clarify.
Yes.
Thank you.
And so all of the data that we're able to share and we will provide, our outcomes are based on female only. But yes, Commissioner Perez is correct that usually when we're looking at just female only in national data or local data, it is actually much lower than the whole number.
Perfect. Thank you very much for your presentation.
Thank you. Commissioner Aganaga.
Thank you. Nice to see you again, Lucy. I have curiosity. Like, I know that you really care about girls more than, concentrate. You have any programs for early prevention, pregnancy?
Yes.
Because I'm a speaker in the high schools. I'm a volunteer for the Young Motivation Task Force.
Absolutely.
And I talk about gang prevention, early pregnancy prevention, and then truancy, stay in the school. And great. So you do have that, right?
Yeah, so
Right,
actually, interestingly, what led me to Girls Inc. from the city of Santa Ana was because I was doing a lot of research on the high pregnancy rates back then in the 1990s in Santa Ana, and that's when I came across Girls Inc. And what really intrigued me was the work that we were doing through the Orange County Department of Education, where we had the highest risk population of teen pregnancies. For many, many years, Girls Inc. has been at the cutting edge of offering comprehensive sex education, and we know that that can be very controversial in our community and in our county, but we also know that work is really successful. We're able to talk to girls and engage them in conversations about how to keep themselves healthy and safe, and really providing them with a wider range of information so that they can make decisions on their own that can really help them. So a lot of the work that we're doing with middle and high school girls, it's very age appropriate, but we are doing that work because we really feel that is really important to ensure that, because we can teach them about literacy, we can teach them about leadership, but if they don't make the right decisions at a critical point in their life, they can derail them from everything else that they're setting their goals on.
And Commissioner, if it's appropriate, I'd love to share with you a link. Actually, we were just recently featured in the national news media outlet Vox.com, where they came and they profiled our sex ed classroom. The article title is called The Future of Sex Ed, and it features Girls Inc. of Orange County, our sex ed content and our education that we're being able to provide to our girls.
Thank you. Commissioner Garcia.
I wanted to say thank you for this packet, the information, the impactful data. It's awesome. I appreciate that, and the letter of recommendation as well. My question is concerning the 4 schools that participate in the, how do you pronounce it, Dibbles? Dibbles, I'm sorry. Thank you. So the school district and Girls Inc., how do you come up with the criteria of the schools that you're going to choose to participate in this program?
So we've already worked with Santa Ana Unified in discussing before applying for this grant, which are the schools that they felt had the highest need. We have some familiarity with the schools because of our history in working in Santa Ana, but also we wanted to make sure that we worked with the district to identify the right schools. So we've already targeted, and it's included in the grant proposal, Madison, Heroes, Fremont, and Wilson are the 4 elementary schools that we would like to work with. We already have an active MOU with Santa Ana Unified School District, so that will allow us to move in seamlessly and not have to wait through the paperwork process or anything like that.
Great.
That also does include a data share agreement, so we're able to test our students. When we test ourselves DIBELS, because that is not always used by all teachers, and not all public education teachers are even skilled or trained in administering the DIBELS test, but our staff is.
Wonderful. Thank you.
Commissioner Tardif?
Thank you for your presentation. I think you have a great and very valuable program. See, one of the handouts, looks like you have a question. It says, why girl only? So, why girl only is my question.
My favorite thing to share for why girl only is when you have a room full of girls, 100% girls, 100% of the time, the leaders will be girls. That doesn't exist anywhere else. So when you have a co-ed classroom with boys and girls, there's a good chance that the leaders, the emerging leaders, the first ones to raise their hands, the first ones to open their mouths, the first ones to get those exciting opportunities are going to be male. It could be a 50-50 split, but what statistics show us is that it's usually male. In an environment that is 100% girl, 100% of the time, those leadership opportunities are going to girls. And that's exciting because we understand that there is a co-ed environment. So all we want to do is prepare those girls to have the experience of being leaders in our girl-only environment so they can have that experience and then transfer those skills into the co-ed world where they can thrive as leaders amongst male and female peers.
Thank you. Commissioner Perez.
No questions, thank you.
I want to thank you both for coming by and presenting. I've actually had the pleasure to see the girls in action, or our leaders in action. I think they have really great role models. I want to give a personal shout out to Angie Gomez, who does an amazing work in our community here in Santa and in Anaheim. And thank you for your presentation. At this time, we're directing the city staff that we are going to go on our break, and we'll be returning back at 6:15. City staff, can you please have the next applicant approach? The Heritage Museum, please come up.
Hi.
Welcome.
I'm Sonora Ortiz. I'm here on behalf of the Heritage Museum of Orange County to speak to one of our proposals, the Borrowing Barn. The Heritage Museum is, of course, a museum and educational center. We are also a community hub, and in our pursuit of becoming a more diverse hub for various means of education and community building, we pursued this previous CDBG grant cycle funding for what we're calling the Borrowing Barn, which is a tool library and time bank based at the museum. So just as a little bit of background for that, a tool library is sort of like a community tool shed or lending library, but instead of books, you're renting tools and equipment. And the time bank sort of goes hand in hand with that, where you're able to volunteer your skills and expertise and time to receive those same benefits from other members of the community. And it's sort of this membership-based, reciprocal, resilient community building sort of function. And this year with this grant cycle for these 2 years, we want to both continue supporting this program as something so new to the community and so unique in how it functions. Having a really strong foundation for it and kind of that well-funded start is crucial. And as we've been building these programs, we've gotten feedback for things that people see as being other components that we didn't write into that first cycle that we didn't realize folks wanted. One of the main ones being community garden space available on site. So we do have currently a community farm, but it's all communal based, and it's also part of our school education programs. So we do have classrooms that go through that space and make use of that. And so in that sense, it's not sort of something that you can come in and rent on your own or grow your own specific things to take home with you, though we do share what we harvest. And so with the Barring Barn, we want to expand that to be kind of those rentable plots, but instead of being rented in a separate system or as a more traditional independent community garden, it will be a part of that existing new Barring Barn structure. And then, of course, we'll continue working with the Tool Lending Library, expanding those operations, and expanding the capabilities of the time bank, because that really comes along with building that stronger community foundation that we're working on now. And so as time moves forward, that will continue to be a more complex facet of its own. And so I have a little more information here just about why this is so important. These sorts of solutions like tool libraries, community gardens, time banks are really important for building a resilient community, especially as we need to be looking at things like sustainability and solutions that operate outside of a traditional economic model. These are great options for that. So it helps remove clutter just on a base level of not everyone needs to own every kind of power tool there is that you might need for a job on your house. And maybe not everyone has the skills to use them. And this is an opportunity for folks to come learn those things, be able to use this equipment, and not have to make the financial investment or the space investment to have those things in their own homes. It's also, of course, in that way more ecologically friendly. And you're really keeping that kind of local economy, local community growing and community building. So I wanted to leave time for questions since I know it is a lot of odd and unusual features here.
Thank you for your presentation. I'm going to start with my left with Commissioner Perez.
Thank you very much. I know at our last presentation I was very strong advocate for the work that you guys are doing and really enjoyed the presentation that you guys provided last year. How are things looking so far? I'm looking at the first cycle of numbers. Don't seem to be very high number. I know there's another data source that you'll be providing us. Do you have your updated numbers as far as your units of service?
Yeah, so unfortunately we are down from what we projected, but it's been because we've had to build more infrastructure than we expected, like physically to house the tool barn. We wanted to make sure that the equipment that we have and that we were receiving with other grant funds we're pursuing and other donations has a secure facility to be at. And so getting that part started, that kind of backing infrastructure, has taken us a little more time than we expected, especially with some of the other events that we've had going on. Mm-hmm. But our outreach and response has been great. And so it's just been a matter of getting all of the paperwork that's required for it to be officially rented through the CDBG funding. That's a little bit harder for us to work on. It was a little more difficult than we anticipated. And so now that we have that infrastructure in place for it to run smoothly from a physical perspective, like we've got our scanner going for the tool library, the software is all updated, everything's working well on that side, we're able to more fully focus on getting those signups back up to the numbers that we were expecting. And we do foresee that being fairly straightforward from this point.
So as I look at the numbers, it was only 7 of 150 you were supposed to serve, and that, I know those numbers were reported from September.
Right.
I guess the issue that I'm going to have is, as I look at the funding, there's $2 million that we're going to need to cut from this year's funding source, and 7 of 150, I mean, we're talking a very, very low number.
Right.
And we're going to have to vote on this proposal within the next couple of weeks.
Right.
How, I know this was your first quarter. How did your second quarter look? Was there much more movement, or it was just the infrastructure wasn't set up yet?
Unfortunately, not much more movement, but that's what we're doing now, is really focusing on getting those signups now that this infrastructure portion has been handled.
And let's just say that the data per se, because we understand, especially being a new nonprofit, that, you know, with the federal and the HUD restrictions and the guidelines. And again, just for me to get a little bit of clarity, let's say those weren't there. You know, what do you think the number would have looked like more if, let's say, our requirements weren't in place?
I think it would be a lot higher. Even for me personally, knowing what the requirements were in advance, I wouldn't be able to sign up tomorrow because I don't have 3 pay stubs on hand from each of my jobs to be able to put forward. And I understand that that's something that's being asked for by the government. Like, I understand why that requirement is there, but it is very slow to get folks able to, like, oh, okay, so now I need to save 3 pay stubs or get access to those pay stubs to be able to sign up. And
I
that's
guess,
been a difficult.
And I guess my next question would really be to city staff on I think this program is very similar to like our Saturday Night Live program, where we don't really have Nathi's group, you know, give us those numbers. And I think when someone's borrowing a tool, I really am not looking for 3 paycheck stubs, you know. So is there a way that this could be something similar that we did with the other program? Because when we're looking at borrowing tools, we're having all these barriers that are being placed, in my opinion, that I think are a detriment to the work that really needs to be done. And to me, it's really more of a matter of, I want to know if we're providing monies for people to borrow these tools, that they can borrow them. And I think the restrictions that we're putting in place, and you know, I don't need an answer now, but if we can look into that, I know we've done it for other programs. I just love this concept. I don't know if it works, to be honest with you. I love the concept, and I think that's something that maybe you guys can discuss later. So they'll touch base with you. There might be an opportunity to reduce some of those restrictions. Okay. It's just, I'm glad you're here, and I'm glad that we're able to know a little bit more of that. But we have awesome city staff that will take a look and see there's some opportunity there. Thank you.
Yeah, no, I appreciate it. And I know we intend, like, our plan from the very beginning was always to have some kind of membership form that people had to fill out so that we would have a way of contacting folks who are renting things, kind of having like a rules agreement of things that they will and won't do with the tools, like a very general sign-up sheet. But again, you know, that's easy to have someone sign on site their first time they rent and keep on file. We do that with our volunteers regularly. We anticipated it would be easier to roll this paperwork into that, and it just is really hard to get all of that information from folks.
Well, hopefully there'll be some support there, but thank you. I appreciate it.
Thank you.
Thank you.
Thank you. Commissioner Tardif, please.
Thank you for your presentation. I don't have any questions.
Thank you.
Commissioner Garcia.
No questions. Thank you for your presentation.
Thank you.
Thank you, Commissioner Garcia. Commissioner Frazier.
I remember when you first came before us with this idea and this plan, and it's a great idea. I was really excited to see it come to fruition. I'm sorry that I missed the first part of your presentation. And I think that maybe it's if somebody borrows a $200, chipper shredder and doesn't return it, that's money that the city loses. So I kind of understand some of the hurdles. But this year, since you have the inventory, maintenance, and the scanning abilities and things like that, what does increasing sign-up look like? What does that?
So one of the things, just literally moving forward from today sort of deal with the current grant cycle, now that I've been able to sort out kind of all of that back-end infrastructure, I'm able to focus my time on calling people back, being able to sit there and remind people like, hey, you said you were interested in this. I really need you to keep these things on file. If you do that for the next couple weeks, then we can get you signed up. We can get this going. I'm able to spend more time pursuing that and working with, we're bringing in a new staff member to help run during the open hours to run the barn itself. And so being able to have them continue to chase up with folks to get those signups fully completed in the system, not just like, oh yeah, I'm really interested and I have this project in mind. So being able to fully pursue those things.
So it sounds like the interest is there, you have the documentation to pursue, you just haven't had the availability to pursue the document.
Right, yeah, and being able to really stay on people about, no, I need you to save this document for us, and come bring it in when you can, that sort of thing. Yeah.
Okay, thank you.
Yeah, thank you.
Commissioner Aguinaga?
No questions, thank you for your
Thank you.
presentation.
No further questions. Thank you for your presentation.
All right, thank you so much.
Next up, can you please have the Heritage Museum of Orange County?
No, I didn't have to.
How are you? Good afternoon, good evening, everyone.
Just before you begin, sir, the announcement is each speaker will be given 5 minutes to present the proposal. The commission has 2 minutes for comments. With that, welcome.
Welcome. All right. So on a completely different note, the program that I'm going to be speaking about is it's a program that's geared to youth. It's called Museums Inspiring Change, or as we've deemed it, our MIC program. So as you can tell, everyone I think would, if you ask people questions, people would say they enjoy museums. Museums are cultural and educational centers that provide valuable information about people, places, and events to everyone. They're really educational hubs. They're an extension of our classroom, of our actual educational system. There's no one size fits all when it comes to museums. There are different varieties such as history, art, science, natural history, aviation, music, sports, and much more. Although there's a huge diversity within the different types of museums, what's really intriguing is that there's a huge lack of diversity within the museum profession. The Andrew Mellon Foundation did a report that provides statistics on museum diversity in museums, art museums. And it was really geared to art museums, but when you actually look at other statistics, there's not any formal report. These are some of the statistics that they came across. In 2018, statistics, 72% of employees in museums are white, and while 28% are people of color. When you break that down further, leadership positions within museums are 80% white, male or female, men and women, 20% people of color. And then that gets, leadership positions are management roles. So not even like directorships and things of that nature, but just more like upper management. When you actually look at intellectual leadership, which would be like executive leadership roles, the statistics are even more kind of skewed. 88% are people in position are white, 4% black, 3% Asian, 3% Hispanic, and 2% of two or more races. In Orange County, there are over 30 museums in Orange County. As of last year, I was the only person of color in an executive directorship role in over the 30 museums in Orange County. So why does this why are state of museums like this? And in my research and looking at statistics, I believe what it has to do with is actually access to these spaces. Access, exposure, and opportunities are not available to people of color, communities of color, and there's a huge discretion in these things. If you don't have access or exposure or even mentorship in these spaces, then you're not going to see yourselves in that space. So let's look at our Santa Ana community. So we have actually quite a few museums in Santa Ana. Obviously, a Heritage Museum being one, where I work at. There's a fire museum. There's Howe Waffle House, historic house museum. Grand Central Arts Center, right down the street. Orange County Museum of Art, the Bowers Museum, Discovery Cube, Lion Air Museum. So there's actually a different type of varieties of museums. I would probably say the majority of our population, our students as well, probably have rarely been to any of these museum spaces. 96% of Santa Ana students within Santa Ana School District are Hispanic. 2% of the school district population is Asian. So Asians and Hispanics are actually the two least represented groups in the museum profession. So Museums Inspiring Change, Mike, is geared towards exploring opportunities within museums. So there's 3 pillars: explore and access. So students are actually going out and exploring these spaces, learning about the museum, understanding organizational structures, how museums principles and things work. And then the last part of it is actually building a network. So students would actually be able to build network with professionals within the spaces. That could lead to internships, jobs, and then obviously just creating a much wider diversity within the space in general. And then we would work directly with Santa Ana youth within the school district. We actually have two schools already targeted, McFadden Intermediate and Lathrop Intermediate.
Awesome. Thank you for your presentation. I'm going to start to my right with Commissioner Frazier.
Thank you. Thank you for your presentation. So you made it a point to bring race into the demographics of the proposal, and I'm just curious. In Santa Ana, the minimum population density of Hispanic is 72% per ward. These are recent statistics. The maximum percentage of white is, I think, 18.2%. You say that access is what's preventing people of color from experiencing these. In Santa Ana particularly, since the majority of people that live in Santa Ana are people of color, they have access to all of the museums that are in Santa Ana, or when they go to the doors of the museum, are they turned away?
So there's a thing that's very interesting. Maybe there's access, but the whole idea of the museums are accessible, the doors are open. But the whole idea is understanding an experience of a family, an immigrant family. So my parents are immigrants. My parents both immigrated here from Mexico. I'm sure we had access to go to a museum, but my families didn't know that. My mom didn't know that. My parents didn't know that. I never went to a museum growing up as a kid. The first time I ever went to a museum was my junior year of high school, and I had to go for a school class. I had to go for a school assignment. My brother actually took me. So the whole idea of access is not necessarily that the spaces are open in there. It's just like, does the community know about that? Do they feel welcome? So
And to that point,
yes.
So the majority of the teachers within Santa Ana are people of color as well. So our educators know about these museums, I would assume. So I'm just having an issue correlating the two, and I think that argument is interesting. But what I want to get to even more is I think that the museums around here are phenomenal. They're really interesting. The Bowers Museum offering free days for low-income families that maybe can't afford to go. It seems like there's ways that the museums are making things accessible to the community that they're in. How will your program add to that accessibility directly?
So there's a difference between actually going to a museum and visiting with your eyes and understanding maybe like an exhibit, and then actually going to a space and understanding how that space has worked, what the opportunities to get into that profession is. And that's what this program is about. The students will be learning principles of organizational structures, how you can get into a role of curation or archival, or if you want to go into education with museum spaces. So they're understanding these pathways into it, because I guarantee you there's been students around the city that have gone to a museum, but when you're going to a museum to enjoy it, you're not looking at it from the lens of, I can do this as a profession. Do you get what I'm saying?
For lack of time,
for sake of time, we're gonna
come back to you, Mr. Frazier.
Yes.
Saginaga?
Thank you.
You're welcome.
Thank you for your presentation, and I really have no questions for you. Thank you.
Awesome. Commissioner Garcia?
I wanted to say this is a wonderful program. It's on the 3 pillars of that are part of this program are wonderful. How do you go, when you work with the Unified School District, how do you go about selecting the schools that participate? Like, what is the criteria?
There really isn't a criteria. A lot of it is just existing relationships with either principals or teachers at school sites already. So the whole plan is to actually open it up district-wide and be able to work with intermediate students and high school students from district. But it takes time to grow those relationships and partners. So like the museum already has a good relationship with the teachers and principal at McFadden. So that was a good, it was good to go to them already and say, hey, this is a program that we're developing. Would your students be interested? And they said yes. Same thing with Lathrop. Yes, exactly. And Santa Ana Unified School District is the largest district that we serve in regards to the museum and the students that we serve. We serve over 18,000 elementary students already. Over 3,000 of those students coming from Santa Ana. So we have a really good partnership and relationship with the school district already.
Thank you very much.
Mm-hmm. Commissioner Tardif?
Thank you. I don't have any questions.
Mr. President's out, but Mr. Kevin, I have no further questions. I think you do a great job at the Heritage Museum, and thank you for being here today.
Yeah.
Great. Awesome.
No problem. Thank you.
Can we have Human Options please step forward?
Thank you.
Whenever you're ready.
Okay. Good evening, Commissioners.
Good evening.
My name is Sarah Tienda, and I'm the Clinical and Outreach Services Manager for Human Options. Human Options is a private nonprofit agency here in Orange County. We provide domestic violence services, and we've been providing them for over 38 years. Here in Santa Ana, we have always served families who are experiencing domestic violence. And we actually currently have 2 programs in the city of Santa Ana which are associated with the Family Resource Centers, the Minnie Street Family Resource Center and the Corbin Family Resource Center. We are proposing to provide intensive case management services to victims of domestic violence who reside in the city of Santa Ana. Domestic violence is a huge community safety problem here in Santa Ana. Annually, the Santa Ana Police Department takes about 5,000 domestic violence-related calls. Also, annually, they put out about 1,000 emergency restraining orders related to domestic violence incidences. Several years ago, Human Options partnered with Santa Ana Police Department to start a domestic violence response team. This is a team that consists of specially trained police officers who go out with a domestic violence advocate from Human Options on calls where domestic violence is an issue. And what happens in those situations is that advocate is there, as the name implies, to advocate for the victim in that situation and try to connect them with services. One of the gaps in services, though, is after that initial linkage, Human Options as an agency has been limited into the follow-up that we could really do. That advocate can only, is a part-time advocate, so her time richly is the initial on-site crisis intervention, and then some follow-up that she can do, but she's not really able to do much follow-up after that. So this program would be to fund a case manager who would be bilingual and who would take over from that advocate to provide services to the victims of domestic violence. And so what would happen is once the domestic violence advocate or a police officer or anybody in the community who has experienced domestic violence, they can come in to contact us for an appointment, come in for services. We would do an assessment in terms of needs, link them to services, provide some services on site, such as parenting or a personal empowerment program, which is for domestic violence survivors. And these services would be provided either out of the Minnie Street Family Resource Center or the new Family Justice Center, which will be at the Santa Ana Police Department. And our overall goals would be in terms of to increase the safety of the families in Santa Ana who have experienced domestic violence through these intensive services, to the domestic violence case management, and really working with them to empower them to get a support system in place and a safety plan.
Thank you for your presentation, Ms. Rose. I'm going to start with my left with Commissioner Garcia.
Yes.
Thank you for your presentation. I don't have any questions.
Thank you, Ms. Garcia. Commissioner Tardif.
Thank you. No questions.
Thank you, Mr. Tardif. Commissioner Frazier.
Yes, thank you for your presentation. We have a couple of people that are providing the service of helping with domestic violence. So my question to you is, I've recently learned that the disparity between women who experience domestic violence and men who experience domestic violence is becoming smaller. What types of, or what do your programs offer to help mitigate the stigma that men might experience in those domestic violence situations?
Yes. Our agency really works on a trauma-informed philosophy, and we do recognize that domestic violence is not a gender-specific issue. And so we, in all of our programs, we do welcome folks of whatever gender or however they identify. That includes in our shelter, in our domestic violence shelter, men, women, transgender. It's open to whoever qualifies in terms of seeking emergency shelter. The same goes for our outpatient programs. Some of our programs, we do have some gender-specific groups, since women still are the majority of the population we see. So we do have, for example, some support groups that are just for women, but growing number of co-ed groups that we have going on. For example, at Minnie Street Family Resource Center, we do have a co-ed personal empowerment program.
Fantastic, thank you.
Thank you, Commissioner Frazier. Commissioner Aguinaga.
Thank you. I'm just curious, how many of the women that go to your program, that I'm aware of your program, of course, go back to this husbands or the boyfriends, then go back to your place again? What do you do? They go back.
Go ahead. Yes.
Back and forth, you know, then how?
I couldn't tell you that percentage of our program at our program for sure, but there is a large number who do go back. We have some that don't ever leave the perpetrator or the abuser. That's what part of this program is, to offer support. So even if they choose to stay with the abuser, can we provide services to make it a safer place? Can we provide services for the person who harms so that they can stop harming? So we understand that it often takes like 7 times for a person to leave their abuser. So we do expect that people will come back, and we do have people who come back for services, which to us is okay because it means they know that we're a safe place for them and they know they can get help with us.
Thank you.
Thank you, Commissioner Perez.
So I read the proposal.
I read the proposal, very well written. Thank you, and thank you for the hard work and stuff that you do. Thank you.
You're welcome.
No comment. Thank you for your presentation.
Thank you.
Thank you.
We're also against validation. Perfect. Do we have Lutheran Social Service of Southern California? Great. And thank you for being on time, sir.
No problem. Thanks for letting me be the last one.
My question?
I think there was a committee.
Whenever you're ready, sir.
Thank you and good evening. Thank you for giving me the opportunity to present before you. My name is Jim Pilo. I'm an Assistant Senior Director for Lutheran Social Services. I'm a corporate officer, although I do oversee the office that we have in Garden Grove. Lutheran Social Services is not a new agency. We've been around for quite a while. We're a faith-based nonprofit organization. There are approximately, I believe, 19 offices throughout Southern California, including San Diego, Riverside, Thousand Oaks, Los Angeles, Long Beach, and so forth. But the office that I oversee right now is the one in Garden Grove. We are, as I mentioned, although we're faith-based and a nonprofit, we don't turn away anybody who comes to our doors, we're willing to assist with. So the three pillars that we work with in terms of our mission statement is to embrace, equip, and empower. And under those circumstances, we embrace those in crisis with short-term emergency services. We equip individuals and families with program resources to help them on their journey, and we empower people to break the cycle of poverty, live with dignity, and become self-sufficient. Our organization primarily works with the homeless. A subgroup of those who we work with are those who are victimized in some way. So much like Human Options, but to take it a step further, under our Victims Intervention Program, we partner with funding from the California Office of Emergency Services from Sacramento, that's where a lot of our funding comes from, to be able to work with any woman who has been victimized. Under their categories, there are 26 different types of victimization, not just domestic violence. However, a lot of those folks who we do work with are those who are victims of domestic violence. And under those circumstances, we provide tangible and intangible services, emergency services, as well as counseling and case management. As the slide suggests, as I mentioned already, we currently are in Garden Grove, although we serve all of Orange County. We have a partnership also of 51 Lutheran churches in Southern California as well. So a lot of funding comes from them through donations or gifting or whatever they provide. And we serve all the cities. Right now we have a partnership with St. Peter's Evangelical Lutheran Church here off of, I believe it's 17th and Flower, where we come out at least twice a month to be able to help them with their food program, because we've, in fact, just recently, we helped them with Thanksgiving, provided them with 20 frozen turkeys to help families who didn't have an opportunity to celebrate Thanksgiving. And then we also partnered with that church to be able to gift 25 different children who otherwise wouldn't get gifts during Christmas. We do screening. As I mentioned, although we're located in Garden Grove, we do go to Fullerton to another Lutheran church. We provide services there during their weekly pantry time, as well as here I mentioned in Santa Ana. We provide tangible services as listed: food, clothing, bus passes, hygiene kits, and typically one-night motel passes. But like my boss asked me today, he says, well, why would you want them to provide, what could we provide more than just the tangible services? And what I always tell them is that these tangible services is basically the carrot. It gets them in the door because they know there's tangible services. These homeless people, they talk to one another. They know full well these kind of services we provide. And then we tell them, we're going to give you these services and we'd like to set you up with a case management appointment to follow up with you, whether you're a male or female, but to help them specifically to find other resources or other items that might be in the community that they're unaware of. As I mentioned earlier, we do have a marriage family therapist intern who's on site, as well as MSW interns, providing individual counseling and support groups. And then, as I mentioned earlier, some of the seasonal programs, including like back to school, as well as Thanksgiving. And I'm getting to 1 minute, so I won't talk too much about that. And then I just have a slide specific because we are currently getting CDBG funds, and we're targeted to do 25 clients. This year, we've already hit 50 as of end of last month. It's actually like 52 or 53. So, and then we're primarily helping them with some of those motel services I mentioned, 7 of whom are here in Santa Ana, and we're also helping with rental assistance and eviction prevention funds as well. That's it.
Awesome.
Thanks.
Thank you for your presentation. I'm
Sure.
going to start with my left with Commissioner Garcia.
sorry, can you go back to the slide before this one with all the stats?
Sure.
Okay. Is 50 the maximum amount you could?
No. It's however many. We, again, because we serve all of Orange County.
I'm sorry, I mean, during the previous cycle of the funds that you received,
Yeah.
was 50 the total amount that, or there could?
The
there
target was
more?
actually, and forgive me for interrupting you, the target was actually like 7 clients per quarter. But because we're here so often and so many people need our help, and because we have additional funding from other sources, we're bringing them onto our program, using some of the funds for CDBG, but we're actually identifying them as CDBG type clients with services through other funding sources. Like I said, the California Office of Emergency Services provides us with funds, so we've given them additional things that are not covered under CDBG. We just don't turn them away. So 50 so far, as of the 27th of last month. We still have approximately 6 more months to go. So if we project it, it's likely that we'll get 90 to 100 CDBG clients. I think our ask is to serve, I don't remember specifically, I'm not looking at the program narrative request, whatever, but I think we targeted like 70 or something like that. And when we were funded, we only were able to serve, we said by that amount, just 25, but we far surpassed that.
Great,
Does that
thank
answer
you.
your question?
Yes, I just
Okay.
wanted to know what.
Yeah.
the total amount. Thank you.
Sure.
Commissioner Tardif,
Thank you, no questions.
Commissioner Perez.
I just did want to let our fellow commissioners know that this organization is going above and beyond, has already met their units of service in their first quarter of reporting. So just want to applaud you for the great work that you're doing, and look forward to grading this proposal, and thank you for your services.
Thank you.
Commissioner Frazier.
Thank you for your presentation. Is continued case management a requirement of continual receipt of services?
I won't say it's mandatory, but we, like I mentioned earlier, as my boss had said, we don't want to just give them one and done services. We want to see some type of a relationship that's begun, so that we might be able to provide them with either case management or counseling or support groups. It's not unusual that they may show up periodically, knowing full well that if we're giving food out, they'll show up once a week, and then we'll just say, why don't we just start doing case management while you're here anyhow? Typically, those case management appointments are about a half an hour long. And if I failed to mention it, we also do case management remotely. We sometimes meet them wherever they may be. Sometimes we'll meet them at a Starbucks and bring an extra gift card with us so that we can get them there as well. To provide services, because it's more often than not, they just are unaware of the type of services that are out there. So we try to be able to help them to connect to services.
And thank you. And my last question is, so it says that you've reached out and you've helped 50 Santa Ana clients with CDBG funds.
Yes.
So, like Mr. Perez says, you've exceeded the expectation. How many of those clients are clients that have stayed with the CERT, that have sought case management and consistently seen case management?
Continuously?
Yeah, not just been a one and done.
25 at least.
Okay.
25 out of the 50.
Well,
And
those really received at least one time case.
at least one-time case management,
Okay.
with the likelihood of continued services. But yeah. I mean, the reality is that we see these folks and we see them repeatedly. Maybe not scheduled-wise, but then they'll just show up either at our office, or as we come here to St. Peter's, we'll see them at the church to provide a continuance of services. It's not unusual for us to go to here and then there's a line waiting for us.
Thank you. Commissioner Aguinaga.
Thank you so much for your presentation, and some of the questions have already been answered, so I appreciate that you're here in your presentation. Thank you.
Thank you for your time.
I also echo Chairwoman, Vice Chair Aguinaga's statement. Thank you for your time. We have validation if you need validation, sir. Thank you for your presentation.
Okay.
All right, ladies and gentlemen, we'll make this very quick. At this time, we'd like to hear from the public. Is there any public comments? Seeing none. Staff, is there any written communication?
No communication at this time.
Thank you. Is there anyone else that would like to speak on this subject? Seeing none. Thank you. Commissioner comments to the public hearing? Seeing none, so we had no public comments. We're gonna jump it back to business calendar. I apologize, but we're jumping back to public comments. Does anyone have any public comments they wish to share with the commission? Seeing none. Staff, does staff have any comments to report?
No comments, nothing to report.
Seeing none. Would the commission like to report? Seeing none.
Yes.
Oh. Commissioner Perez?
Yes, real quickly, I just want to remind everyone that this is a new process of our CDBG funds. So this year, after the members actually speak in front of the entire commission, there will be an ad hoc committee that will review and actually score those results. After that review, the recommendations from the ad hoc committee will bring back the final recommendations for CDBG funding. We're hoping to do that on January 22nd. After the January 22nd meeting, we're looking to bring those recommendations forward to City Council in March. Thank you.
Thank you, Commissioner Perez. This meeting is adjourned. Next special meeting is scheduled for January 9th.
Question.
Oh, I apologize. Before I hit the gavel, Commissioner Garcia.
A quick comment about our new process. So
Yes.
it sounds great, and I'm on board, and it's I'm excited to see how it goes. I did have a request. Are we able to see the proposals before the next meeting on Thursday? Just so we can scan them quickly and have an idea. I mean, I'm very familiar with all the organizations because I've been doing this for a few years already. But it would be great just to quickly be able to scan them before the presentations. Is that possible? I know
That's possible. So tomorrow morning when I get in, I'll give everybody access to all the proposals so you guys can review them. And the only ones who will complete the evaluations would be the ad hoc members.
I totally
But
understand that, yeah.
everybody will definitely have access to it.
That's what I'm asking, is it possible? Because I know that's
Yes,
might not.
effective
Okay.
tomorrow morning.
Great, thank you.
Sure,
Commissioner
welcome.
Frazier?
And even though I don't vote, I'd like access to the proposals so I can see them, so I can make informed questions.
No problem.
Quick comment, Chair.
Commissioner Tardif, go ahead.
I'd just like to thank staff for setting up a very efficient and well-run meeting. I think we're out of here a little bit ahead of schedule.
Thank you,
So
Commissioner
thank you.
Tardif. This means adjourned.